Prompt and short.
Great.
All right, I want to welcome everyone to today's meeting on April 15th.
Yep.
So we're going to get started and read through the introductory script. This meeting is being held virtually and in person and is hosted by the Utah Department of Health and Human Services Center for Medical Cannabis based in Salt Lake City, Utah. Public notice of this meeting was provided as required under Utah's open meeting laws and was posted on the Utah Public Notice website. In compliance with Utah's open meetings law, this meeting is being recorded. A recording of this meeting will be posted to the Utah Public Notice website no later than 3 business days following the date of this meeting. A rough draft copy of the unapproved written minutes will be posted to the Public Notice website within 30 days of this meeting. Approved minutes will be posted to the Utah Public Notice website no later than 3 business days after board approval. Moving on, let's see. So every proposed agenda item must have a 1-page summary of the topic submitted to MCPAB@utah.gov no later than 7 business days for 7 days prior to the board meeting. Board members will present the 1-page summary during board meetings, and board members will discuss the summary. If no written summary is provided to board staff, the relevant agenda item will be removed from the agenda. Only items that have been submitted in writing in advance of board meetings will be allowed during discussion by the board chair, including presentations from the public. Board members will then request additional presentation and memorandums on those agenda items from relevant bodies to be presented at the next board meeting. Those presentations and memos will also need to be submitted to MCPAB@utah.gov 7 days prior to the board meeting. Public comment instructions. Public comments will be limited to 2 minutes per person. If you want more time, you must request it from the chair. The chair may accept or reject requests for additional time. A public comment period is not guaranteed every meeting. The chair has the authority to create or remove public comment period from the agenda or during the meeting. You can look over public comment guidelines that are posted on the Utah Public Notice website. Please state your name and your affiliation when making a public comment so it can be reflected in the meeting minutes. Only comments made on items listed on the agenda will be considered. If you have a comment about an item not listed on the agenda, please email them to MCPAB@utah.gov. Public comment via Zoom. The Zoom public chat will be disabled during Zoom meetings. When the chair indicates it is time for public comments, you will use the raise hand icon on Zoom to indicate that you would like to make a comment. When you are called on, you will be taken off mute. Take 2 minutes to make your comment. See, sign in on the public comment sign-in sheet with your name and indicate what agenda item you want to make a comment on. The chair will indicate when it is time for public comment period. The board chair will call on you when it is your turn and you will come to the public comment table. Take 2 minutes to make your comment. As a reminder, if you are in person, please do not speak when others are presenting. Our mics are very sensitive, and those attending over Zoom cannot hear when there is more than one person talking at a time. Side conversations and comments from the public during this board meeting are prohibited. Please use a voice that is louder than your typical one when speaking, commenting, or presenting. When you speak, please lean in towards the table as if there were a microphone. For additional information, to make suggestions for agenda items, or to contact board members or staff, send an email to MCPAB@utah.gov. And with that, our meeting officially starts. We'll go ahead and did everyone have an opportunity to glance over last month's meeting minutes? Does anyone have any recommendations or requests for changes? If not, I'll look for a motion.
Second.
All those in favor, say aye. Aye. Aye, it is passed unanimously. We will move on to administrative business, which I believe this time I don't have anything. And that will turn some time over to Mr. Oborn.
Great. Well, welcome everyone. I wanted to just give the monthly general statistics, which some of you find interesting. So we'll share some of that. So at the end of March 31, 2025, the number of medical cannabis active cardholders had reached 97,935. And we just ran that report. And as of today, April 15th, we've reached 98,966. Last month, 55.4% of active medical cannabis cardholders registered with DHHS in March made at least one purchase of medical cannabis in March. And also 978 qualified medical providers are registered in the program as of the end of March. And that's an increase of 20 since the end of February, which represents a bigger increase than we typically see in the number of QMPs month to month. So it was good to see that that dramatic increase between February and March in the number of medical providers participating in the program.
Rich, did you say 55% of patients made one purchase in March?
55.4%. Yeah. And the detail about those numbers is in the monthly report on our website, but that just is the percentage. Okay. And then 87 pharmacists that work at the medical cannabis pharmacies, the pharmacy medical providers. There's 87 of those. And then just prior to this meeting, we did just a little comparison of 2024 Q1 medical cannabis sales and 2025 Q1 medical cannabis sales. So this is January, February, March from 2024 compared to January, February, March 2025. And comparing those 3 months, there's a 12% statewide increase in net sales of medical cannabis products. And in the number of actual units purchased, I believe the increase was 10% increase. Are there any questions about those statistics? And also as a reminder, you can reach out to us or AG if you wanted more detail about some of the stats. We can provide those to you. But any general questions?
Are you all able to let licensees know when we reach 100,000 patients? Because it's something that you probably want to celebrate and notify people about.
I think we'll throw a party.
Yeah, no doubt. And with the amount of work that's happening this week, it could happen within the week. So yeah, we'll let you know. Okay. And then medical provider outreach. We held a medical provider quarterly virtual meeting on April 10th. And we had about 35 participants. This included medical providers registered throughout the state and also representatives of various medical cannabis pharmacies and medical clinics throughout the state, and some clinic owners. And so we covered quite a few topics, but one of those include legislative updates. Obviously, those are really important to them. We always like to focus on those items that are specific to them that change in the law. And one of the most critical items is Senate Bill 64 had the provision that required that a medical cannabis pharmacy not allow a recommending medical provider to recommend medical cannabis as part of an event that is a temporary gathering, market, clinic, promotional event that operates in a temporary tent or structure and is held within 500 feet of the medical cannabis pharmacist property. So we did bring that up, and that's also something we've notified them about, or we will notify them about in an email that'll go out shortly as a newsletter to make sure that they're aware of that. Also, DHHS is presenting at the Ogden Medical Surgical Society on May 15 and the Utah Nurse Practitioner Pharmacology Conference on May 16th. And then the Cannabis Research Review Board held their last board meeting on April 8th, and it went well. We were able to finalize some items, and then also I know that the U of U, as we've discussed before, will be organizing a meeting where they have some of the members of the existing Cannabis Research Review Board joining their advisory board and helping them as they continue to review literature and make recommendations to us regarding the guidance documents that we have posted on our website that are specific to different conditions and that. So we just are really grateful for their service. Of course, Misty was one of those board members, and we're glad that she's going to continue to support the program through her membership on this board and also through her support of the University of Utah Center for Medical Cannabis Research. Okay, and then also just on implementation of some of the 2025 legislation, we have the two of the major items that we're working on right now. The first is the patient product information insert, and we will be discussing that during today's meeting, but we did these past few weeks get some good input from medical cannabis pharmacies and from cannabis processors. That meeting was held on April 3rd, and then we held a meeting with medical providers on April 10, where we were able to just get some good input, and some of which we're incorporating into what will end up being the final version of the patient product information insert that'll be posted online. It's already posted as important information about medical cannabis on our website, but we're just making tweaks to that. So we'll talk about that project in a little bit later in the meeting, but that just gives you an update on some of the parties that we've consulted with already on that project. And then we'll be sharing a QR code and a web page address with the pharmacies that they'll then incorporate into their, if they choose, they can choose how to implement this, and UDAF will follow up with them and make sure they're doing it. But they can choose to make it virtual in a email or a text with a QR code or a link to a web page, or they could do it on paper as well. So but in order to do that, they have to have a QR code and a web page address. So we'll be sharing those shortly with the pharmacies with you in coordination with UDAF, so they can have those to incorporate in their materials. And then also the electronic verification system privacy education requirements. So this legislation required that QMP proxies, those that act on behalf of the QMP in the EVS system, that they read through or that they complete some education about patient privacy, as they'll be accessing very private information in the EVS. And so that requirement becomes effective on May 7th, so in less than a month. And our plan as we launch that is to have that information be something that the QMP proxies, when they renew their registration with us, that they'll acknowledge that they reviewed. And then shortly, we would expect late May or early June, we'll have a formal course that they'll complete that will be, we're just having to purchase some software in order to make that happen. And so it'll be a little more formal later, but to launch it on May 7, it'll just be something they acknowledge that they understand as they read through and state that they understand, okay, yes, this information needs to be kept private. It's in the EVS, and here's some laws that apply to that privacy standard. So yeah, and then a few other changes that don't become effective until July, but are really important to patients are for sure the fee reductions, the transaction fee going from $3 to $1.50. And then the medical cannabis patient card fee going from $15 to $8. So we still have a while till those will become effective, but those are, of course, important, and we'll take action on those in July.
Will the transaction fee be updated in MJ Freeway? So it's $1.50, or is that something we're gonna have to manually do on our site?
That is something that you can manually do as an owner of a pharmacy and pharmacy as you use the MJ Freeway software, you can create that. I believe it's something that you put in the cart
As a different SKU.
as a different SKU. Yeah. So that's how that works. Yeah, and if you don't change it, I'm sure patients will let you know, hopefully,
Um,
right? Yeah. Yeah, so those are some things that we've been working on, and are there any questions? Okay,
Thank you, Rich.
great.
Turn time over to Dr. Forsythe.
We, as everybody probably knows at this point, the ICS system, we're working on implementation to replace MJ Freeway in collaboration with Salesforce and AST. We've been having some difficulties getting all the data moved over from MJ Freeway into the new ICS system. Happy to report we've kind of begun the phase of working with the AST to get some help on getting that data transferred over. It's going to be a little bit longer process than we had hoped for. So we started just yesterday with working with them on kind of doing some demos for the industry. And today we're starting with the MJ Freeway demos for AST so that everybody can be on the same page. And the plan is to have the data completely moved over into the ICS and go live in mid-August at this point. So it still is a little ways out, but it is going to be quite a lift to get it there based on what we know of the system. So we're hopeful that that will go smoothly, and we appreciate the hard work the industry is putting in to getting that all set up correctly. We have calls set up with AST every day, pretty much here until August, and the representatives from each of the different licensees have been invited to those. So if anybody wants an invite to that and has not received that, please reach out to us and let us know. We'll make sure that you're able to attend there. Anything else?
I would probably just add that tomorrow we're meeting with a number of municipalities based on the bill that was passed and signed with the odor aspect. It's just the very first steps in doing that and working on some equipment to be able to do that. And industry should expect to get contact by us to start kind of working out times and maybe some things to come and check and things like that, so we can start that process of doing the study and being able to report that by January. So.
One thing I did fail to mention that we talked to the medical providers about that I feel is important is the EVS has been enhanced to include a very clear indication of whether a patient has purchased their limit or not, or whether they can buy or can't buy. And so that is posted in someone's account as a pharmacy agent or a pharmacist reviews things. They can see that really clearly. In the past, it wasn't as clear. And so now it's really clear as to whether they've reached that limit or not and whether they can buy or not. And often the reason why they can't buy is because the patient just needs to renew their card. So anyway, that is just a new enhancement that we've incorporated into the EVS that is, I think, a tool for pharmacy agents, for pharmacists, for medical providers, and QP proxies that are using the EVS.
All right. Appreciate the updates. We'll go ahead and move through this agenda. The next item is some Utah Department of Agriculture and Food draft rule updates.
I'll be taking that on. So just for the board's information, the department spent a lot of time, and actually for the last several months, kind of going through the statute, through the rules, trying to do the best that we can to kind of turn future relationships with the industry into more of a conversation. Really letting licensees tell us how they're going to meet the statutory requirements versus the department telling exactly them how to do that, the rule. Trying really hard to not get too far into the weeds, and not make rules heavier than the statute, and definitely not having rules that are against the statute in any way. We had a lot of meetings internally about over clarifying things, or putting so much into the rule, which it's tough to actually meet that rule. in reality. And also along the lines of clarification, is it a situation we've run into a past where there maybe needs to be further clarification to make sure that nobody's in, out of compliance? Or is it something that we can back off of that clarification and kind of let that roll based on statutory language or things like that? The other aspect, probably the biggest aspect overall, is something that is the same throughout the industry, is the testing. Where, we feel like we can actually make some of these changes based on the fact that everybody has to meet those testing requirements overall, and should allow us to really just, I don't want to use the term ease, but to kind of to take a look at it that way. As far as that goes, there's on one hand, in some other industries, you would see that if people are maintaining a high level of internal testing or some quality assurance, things like that, then they could maybe start to not have to test their products quite as much, things like that. Whereas we're looking at this kind of on that opposite end with the amount of testing that you all have to meet, that there may be an opportunity to kind of back off on some of these other things. So there's quite a lot here, so bear with me. And as always, my voice starts to go as it's time to talk. But we'll start with the cannabis cultivation rule R66-1-2. The definitions here, the only change that you're going to see there is removing the definition of applicant from this rule. As you'll see in the next slide as well, and you all probably are aware that we have R66-9, which is the new licensing rule that we put into place a year or so ago. And that's where that type of aspect would go. This rule would be completely for current licensees, and then the R66-9 would actually go to the licensing of that stuff. So if you go to R66-1-3, the cultivation license, quite a few things being taken away from there. Removing 4, 5, and 6 for the reason I just mentioned, to add that to R66-9, the licensing rule, because it talks about the application and things that need to happen in order to get licensed versus being licensed. Removing number 8 at the bottom there, because that exact wording is in statute under 441A-201. 15A, I believe, that talks about the ownership can't be transferred. The 50% thing about doing a whole other application, things like that, is actually in statute. So we would just be leaving 1, 2, and 7 would become 3 on that aspect. In R66-1-4, looking just at a couple of aspects of it. In addition to the first portion, number 1, that adds meet the requirements described in the section 4-41A-204, which it says that needs to have a description of the physical characteristics of the proposed facility, or for a cannabis cultivation facility, no more than 2 facility locations, including a floor plan and architectural elevation. So that's kind of what this portion is about here. Also removing the square footage of the rooms and aspects that do not actually grow products. There's not a need for that to do that, just based on the wording again in statute. The only things that we need to know, the square footage or the area of, would obviously be the growing areas there. Still continuing on with section 4, 3 through 8, removing 3, 4, 5, and 6, A and B, and really referring it to the statute under 41A-204, 1C through 2, which talks really about what needs to be in an operating plan. So just really, instead of spelling this out completely in rule, it would be there based on the requirements in statutes, such as the employee training standards, the security plan, a description of the inventory control system, your storage protocols, both short, long term, things like that. So mostly all that being spelled out there. Removing, sorry. Removing 8, on the scales, we talked about this quite a bit, but still a requirement to maintain certified scales, but, really remove that portion for the sale of that, but just because the statute itself does state that weight needs to be entered into the ICS, that we felt that we should take that away. One thing to take a look at is on the waste disposal plan, that just adding the words that complies with 4-41A 405. And we'll talk about that specifically in a moment as we get down to waste disposals very shortly. Moving on to 5, removing 1 and 2 under section 5, because it's stated in statute under 204 2B1, that the cultivation facility, you know, is 100, the max is 100,000 indoor or 4 acres outdoor, with the ability to mix that if you want to, and then we'd be turning 3 into its standalone here, because the statute does require the department to come up with a formula, which has been in place for 5 years there, so keeping that aspect of it. So moving on to 6, removing 1, but keeping 2, and then also removing 3 and 6, because that wording is also in statute, just includes a video recording system that tracks all handling and processing of cannabis or cannabis product in the establishment or pharmacy. We thought that was one of the situations where clarity started to be too much into that aspect, where we're trying to over-define areas that may or may not need. I know that JD, that's a year or 2 ago, as we were discussing, you guys' office space and stuff like that, things like that, we're trying to.
Yeah, and I think that was one of the questions that I did have, because the way it reads now, right, because you guys used to define where the control area was, so we knew where we had to have cameras. Now it's basically, it's a little more wide open. Are you guys gonna take the same interpretation that if cannabis activities are not going on in an area, we don't need cameras? Because I don't know how to explain to someone who's gonna put a camera in the bathroom. I think that's illegal. So I don't know how, but I figured that was the case, so
Yeah.
just ask.
Yeah.
You guys are gonna take the same interpretation, even though the language itself is the different definition of the areas being removed.
Unless your employees are smoking cannabis in the bathroom.
I think we're okay there.
I still don't want video of that.
Yeah.
But yeah.
That's the one spot where they can go hide, that's what I tell them. I'm like, hey, you're gonna do the shady stuff, you know, just go in the bathroom.
That's what I think.
Yeah.
Why?
And to your point, JD, yeah, it's just, it simplifies, does remove the definition overall, but we felt it was simple that if there is cannabis or cannabis products in that area, they're being handled anyway. So
Because that's what the statute talks about,
Yeah.
right? It doesn't define control area, it just says where there's activities.
yeah, we're also hoping what that does is to kind of take away that aspect. I know there's always been discussions about cameras and things like, right, is like we're coming in saying you have to have one here versus it is a situation to where we can, you know, it may be hopefully a better way to have that discussion that I mentioned at the beginning. So let's see. Also, portions of the security plan is actually laid out from 6 is laid out in 204 of the statute 1D, saying that the operating plan includes a security plan. We'll talk about a little bit more of that. One thing to keep just to look at here is the portions about agents and their identification badge, and as well as being escorted there if they're visitors. In different spots of the statute, if you look through it, there is requirements to be able to identify who that person is that's coming in, and based on age, because there is an age requirement that goes with that. So we did ask that there was an age that's asked out onto there. The statute does say in some points that the time that they're there, the time that they leave, and why they're there. You know, so the purpose of the visit. So we kept all of that stuff. The one thing that was unsure was the badge number issued. But we did decide just to overall keep that because it's something that's there, and maybe for help and identification purposes, if it ever comes, it at least gives you guys that opportunity to make sure that you've accounted for everybody and things like that. On to R66 1-7 inventory control. removing one because that's actually stated in statute itself. But keeping 2 through 5 as far as the things that need to be identified in the ICS, as well as having the tag. One of the things that went off of this is, instead of having, and you'll see this in other rules as we move on, possibly depending on how today goes, on removing some of those requirements for some of the times that you have to go and do like secondary pharmacy is the one that comes to mind, about the monthlies and the yearlies and things like that. This is usually a daily aspect here, but it does say inventory needs to be kept up in real time. We all obviously understand the ICS system and where we're at with that, and also that ability to just be able to show inspectors where this is in the process type of thing. So it's not like we're there ever after work that often anyway. So it doesn't change much. What it does change is just remove some of those other requirements that can or cannot be kept up in the best way possible. So removing 6, as far as well, that 6 is the one that I was just talking about reconciling that aspect of it, and then adding actually wording to what is going to be renumbered. It used to be number 7, but just adding some requirements for reporting of disparities. If you're receiving things from other licensees that the listed weight on the manifest is greater than 10% off, then we would like to know about that as quick as possible. If we put a 1-day aspect there, just to be able to go take a look at that if we need to. On to section 8, which is agents. 1 through 3 is all in statute under 301. We wanted to keep 4, 5, and 6. They'd be renumbered, obviously. We want to obviously make sure your agents are doing what they know what they're supposed to be doing. It hasn't been too much of an issue to this point, but we felt it was important to keep that in there as far as that goes. But just maybe them going on to one of our approved training aspects does not necessarily mean that they know what they're doing in your facility aspect of things. Keeping their identification badge, we thought was important for identification. And then so that's what 1, 2, and 3 would be. We removed 7 again because that's actually required in statute anyways, keeping a list. Sorry, I'm using my on to section 9. This is actually removal of one section and replacing it with another one. So I'll talk about the addition of the irradiation portion. As most of you recall, in HB 54, there was language, or is language, and we'll go into to effect in a couple of weeks, but allows for the use of irradiation for remediation and quality assurance at cultivators. And so we took the language from the processor rule that currently has irradiation on it for the processors to be able to do, and just change those areas where we refer to processors and change it to cultivators. Other than that, it's the same wording that we had or that we do have currently in R66-2. This next portion is the removal of the pesticide and fertilizer.
Cody, before you get to that.
Yeah.
I noticed up under 1A, it looks like there may be a typo, like the little I or little 2 didn't get moved down. Or there was something there, just if you look at it, it looks like there's just a typo.
So under 1 or
1AI.
And then it's the little, 1AI, but it looks like the little II might be, didn't get moved down, or maybe that's supposed to be a.
and actually, why I was reviewing this today, I found other places to share it.
There's another one I'm gonna let you know about.
Yeah.
Probably.
So with the radiation, and this is more from my own understanding, in the operations plans for the facilities, will they have some verbiage about safety of the employees and? Okay.
Yeah, but and there's a requirement for them to have the other state agencies have to deal with that,
Sure,
take a look
yeah.
and all that stuff. So, yeah.
Other symbols and signs, you've had a minimum size, like the Utah logo has to be at least 1/4 inch.
On the labels,
Yeah, I mean, on here, it just says that you have to have the Radura symbol.
so maybe adding a size
I
to
would-
it.
I mean, I just don't know if, like, I mean, they do it the size 1/16 of an inch was the minimum size for text.
The one that I've seen so far on products is about the same size as the
Is the-
THC symbol.
I mean, I don't
And they
know, I
also-
don't know if there's a standard out there within the foods or
And they also
something.
state, like,
In the,
text, as you go down to the fact panel, that it's treated radiation. And then we as a pharmacy are already putting on our website, a summary description. Product has been irradiated, so patients are aware. So
Perfect, and that'll go into two as well, because we did add an aspect that says if you're receiving irradiated plant product from a cultivator, that there is the same type of traceability and
Yeah.
ability to do that, so.
you
You'll
can't
see that as
people
well, but-
radiated and then forget it got radiated.
Yeah, so,
It looks like the federal regulations require it to be at least 1/16 of an inch tall.
Oh, it's
the
small.
same.
Food.
Same as this, the O,
Oh,
the smallest O.
it's a quite a small symbol.
I mean, it would
Be a
make
very
sense
small
because
Yeah,
the
that
same
would be-
size as
Yeah.
as the THC.
We might go a little bigger than
Okay,
that.
it's up to you.
Also, too, it's not a very common symbol, so
Yeah.
Right.
I did appreciate that at least the one producer I've seen from also states it
States it.
on there. That might be helpful too, because the Radura symbol, I think a lot of people are just gonna be like. yeah,
And Rich, that might be something to add on the health side,
Yeah,
as it is becoming more prominent to have irradiated cannabis in Utah. Maybe have a, I mean, we're starting to see it out there, so
So far, we wear those.
I know who has the equipment. They just haven't used it yet. So, as it gets more common is what I should say. So,
Sorry, yeah, thanks, guys. As I mentioned, we're removing the pesticide and fertilizer use portion of 9. The statute under 204-2A states that the operating plan will include pesticide and fertilizer use, so you planned, uses there anyway. You know, and there's a lot of things also within our rules that we actually maybe in vain, or I don't know what the right term is to adopt it. Some other agencies or some other divisions regs and maybe put it a little bit further than maybe we should have. And so this is one of those situations where our plant industry, our sister division obviously has the overall say on pesticide and fertilizer use type of thing. But you know, the overall does need to be in the operating plan, but we felt like that could be there overall versus spelling out so this way, and then again replacing it with the radiation portion. On to 10, which would be 10, but the complete removal of the transportation portion of it. That would be based on that the statute R41-404 covers it completely. It goes on to say in 404 who can transport it. It's got to be an agent, right? It's got to be an employee of the licensee. It's got to be all those things there. In 404-2, again, it's employed by the licensed entity. And it talks about the manifest that includes the unique identifier, the links to the ICS. It includes origin and destination information for the cannabis product and things like that. So it's really covered in that, although we are very specific on a whole lot of things, especially in 7 as far as the transportation goes about being shielded for public view and securing temperature and things like that. We obviously would like there, and I think there's portions in statute that do say to make sure you're storing that in a way that keeps it safe for human consumption. But overall, it's in statute. The one thing that might want to be talked about in future meetings is, and I know it's been brought up before, and I don't know if we've got to that, but electronic manifests and what that looks like as far as having at least some amount of digital trail to be able to track any changes or things like that. But I think it's something that the department is completely on board with. R66-111, the recall protocol, it would become 10, obviously, but we're not planning on making any change to that. It's fairly broad. It still gives, you know, it gives a couple of reasons for the department to do a recall, but overall, it's meeting those requirements called out in 701 of the statute that says we would establish protocols for recalling cannabis from the establishments. 12 is another one. We had a lot of conversation on this, so this is one we would take input from for sure. Specifically, I should say, on the minimum requirements for storage. In 204 of the statute, it does say that the operating plan will contain storage protocols, both short and long term, to ensure that cannabis is stored in a manner that's sanitary and preserves the integrity. Sometimes I said meant. Right now, we're kind of leaning towards keeping it. I have it actually marked off in 2 as getting rid of it for this, the need of conversation, really. You know, the list that we have here is not the only thing to be taking a look at. You know, the 6 inches off the ground thing comes to be a concern if you've got super sacks on some aspects and things like that. So things to keep in mind. We went back and forth on keeping it or not. Obviously, the statute does say there's storage protocols, as I mentioned, for sanitary and integrity. These are fairly light ones, so something to keep about to think about for the industry and patient safety and whatnot. Moving on to cannabis waste disposal, which is currently 13. We would be getting rid of that entire aspect. This is one that I'm not quite sure that even the department's rules we're meeting specifically the statute. The statute calls out in 405 that a medical cannabis waste, what that defines that, and what a production establishment shall do, which was render it unusable and unrecognizable, dispose of it in accordance with federal and state laws, rules and regulations related to hazardous waste. Also making sure it's in compliance with the Resource Conservation and Recovery Act, as well as the Solid Waste Management Act, and other regulations the department makes in accordance with our rules. And then an individual that may transport or dispose of cannabis waste other than is provided in this section. Again, that's back to the statute, but you know, what we were thinking is that we probably need to have a look based on the statute on what those requirements that are laid out there and actually follow those instead of us telling you here's the exact things there, because it is one that at this point, I don't think we're necessarily meeting the statute even in rule. What is currently 14, change in operating plans, no change there. A small change in 15, which is renewals. One is, as the industry knows, we have our licensing board for cultivators in December. It could be towards the beginning, could be after, you know, after mid-part, things like that. But we wanted to give everybody enough time to get everything in and have it kind of set. So we thought about changing it to November 1st deadline, have the renewal and application notice sent to us. And then number 2 is a change. Mostly you guys can blame me for this one, but I'm sure you guys get as sick as I do of hearing me at licensing board meetings. So I thought you all could want to come up and get the report on yourselves. So,
Is that citation right? Because we look at the processor one, it says 441A201.110B.
no, I think
That should be 10B II.
I think I'd actually probably just copy and paste it. And one will be underneath the other, but I can.
Okay, because I think it's 10B.
Yeah.
II and then 10B II. Processor.
Yeah, I think you're right. I think I just copy and pasted. And then just a quick speaking of what JD did about making sure that there's an addition of the 2 in number 3. Currently it says 441A03 and it should be 203. So no changes in the violation categories aspect. The statute in 801 does require us to make rules about fines, obviously with things coming up to on May 7th about the letters of concern and things like that. It's something that we'll keep embarrassed on statutory language. But obviously our administrative actions take a little bit different route moving forward. So that is the cultivation rule. I'll leave it up to you guys if you want me to continue to 2 or if you guys want.
We did have people sign up for public comment, but before that, we'll open the board. Does anyone have any questions or comments about our 66-1? You guys saw it addressed in the moment.
Yeah.
Okay, let's see, we'll go ahead then and open it up to public comment for those in the room. Nareth, Tom, so we have.
Tony did a wonderful job of clarifying my original questions, so I
Okay.
will go back my time. Thank you.
All right, we got back in minutes.
So, Tony, good job.
I'll go for that. Okay, we don't have anyone online. All right, we don't, so. Okay, with that, Cody, let's do round two.
All right,
Let's go faster this time.
I will do my best.
Unfortunately,
Unfortunately, this is the processor rule, and so it won't be faster, I almost can guarantee it. One of the things to keep in mind is everything I said at the beginning, but there's a handful of things within this rule that the lawmakers gave us rulemaking authority for, and there's a lot of subjectivity to those rules, or the portions that they gave us rulemaking authority. So we're gonna do our best, to remove as much subjectivity as possible with some of these changes. I know that that's not really totally possible, but as I get to them, I think you guys will, hopefully, we can discuss it and you'll hopefully understand what I'm trying to say. Part of it would be that we're trying to err moving forward on starting with the approval of things and only denying things. Right now I'm talking about like logos, brands and labels, for the most part, saying it's approved until we have as much proof as we possibly can get and as little of subjectivity to say this is going to be denied. Again, we'll talk about that, I'm sure, as we get to it. We'll start with the definitions. As I mentioned in 2B here, I'm trying to remove the subjective word, which is appears to. Again, what I wanted to do is, like, if we're talking about something that is appealing to children, that my team will have to be able to show, for the most part, that we have proof that this is appealing to children, whether it's you know, the Trix rabbit or whatever, right? Just be able to almost print something off is what I'm trying to get to in that aspect, versus, well, I think it is type of aspect, and have that argument with anybody. Again, we're moving the term applicant from this, or would like to just and put that over into R 66-9. Batch is defined in statute, so there's a pretty big deal with batches mentioned during some meetings during the session. So just want to make sure that we feel that that's as important as it was put out there during the session. And this is a further definition of a brand name. There's been back and forth because we allow logos and brand names since we took over really the heavy lifting on labels. We didn't want pictures or other symbols or as part of the brand name. That continues to be an issue with us for a handful of companies who keep kind of changing on a more regular basis than some of the others do. And they try, and then they always try and make it look like, oh, they'll switch what a brand name is with other things. So it's just been a little bit difficult for our labeling review team to get that down to a science, and they never be able to do that. Last thing on the definitions is down on 27. This is another issue for clarification on labeling. As you all know, that the measurements that we use for product base, when it comes to bottles in that cylindrical type of container, just trying to put it out there that if it does go all the way around the product or the bottle, I'll say, then we'll look at 50% of that as the product base. If it doesn't go around there, it'll just go to the same measurements as if it was a flat or a bag or something like that. So hopefully that's what that gets to. And then also that if it's people have logos and brands to sum up on the lid and things like that. So hopefully this next language under B clarifies that all of it is being counted. So again, just clarifications for labeling, if you would. So
So back on number 4 and 5, just to switch on spelling order. Bring the after order.
all the way up on 4 and 5, you said? Yeah, just say that one more time for me.
So the spelling, if it's all alphabetical.
Oh, I got you, just out of, oh, okay, gotcha. Yep. R62-3, removing a lot of that, again, because it's going into R60, or would like to put it into R66-9. Keeping one, but making that change to say, that the cannabis is coming and going from cultivators and processors. The labs are supposed to be dead ends for the most part, so didn't necessarily wanted to, we did want to clarify that. Want to add what would be number 2 now, to clarify where product can go for sale and things like that. Removing what used to be 2, which was the tiers that we defined. SB 64 took that definition and put it in the statute for processors to be able to have 2 different locations moving forward, so no need to have it on there. And then keeping 7, which would become 3, just the expiration of licensures. The statute had said that it was a December thing, and obviously we all know that it hasn't been a December thing since the beginning. So just clarifying that, it's got clarified in statute, and we'll keep this as well. And then 10 again is just that transferable aspect of the license. It's already in statute we've talked about.
Cody,
Yes.
does adding number 2, is it interpreted to mean that as a processing facility, you cannot send or transfer material to any other facility other than a pharmacy?
No, sorry. So I might have spoke when I said that. But what it does is pretty much define specifically what a processing facility, right? Sometimes there's questions about, and it's mostly at the cultivation level, where people they start to take their cultivation and start to do a small amount of processing type of thing. So it's just that what we're trying to do is clarify that this should be a distinct aspect between cultivation and the manufacturing is happening there.
Yeah, I just know that there have been situations where a processor has sent material to another
Yeah, it would just be really about what the license is allowed to do, not necessarily send it, but if we need clarification on how we can, but. Now that I've read it and spoke to it so much, I can't remember what I just said. On 4, quite a few changes as far as the facility requirements, again, removing square footage from that aspect. Also, there's not a need for square footage really at all for processors. We just need to know where things are at and what rooms, and hopefully we know every room that's there, in case they're, removing the emergency plan. This is something that we felt might have been just above our jurisdiction. In the requirements, because obviously there's local ordinances, there's other state agencies and federal aid that may have to meet that, such as that type of stuff. So, but it's something that maybe it was an overreach for us to do. Adding language, requiring operating plan to meet the waste disposals in 405. There's another waste disposal portion we'll talk about, which we did before. Which we removed that. Removing the compartment language in 5 and 6. I think that based on the training that takes place and the people that or employees, I should say, processors want to have there, they're going to do a good job of having the people that are trained for that and they're specialists in areas, and not allowing certain things, especially the way some of them are built, may not necessarily lend itself to being able to truly keep up with that. And then again, trying to remove subjective language if possible, down below, and then remove 9 at this point, just as you all know that the complaints on the label, or on the label, it says that the complaints should be coming to the department type of thing. That might be something we're talking about, since there is an ability for processors to have a website now, if there's going to be a contact aspect. So just some food for thought. This again, separation of, or in section 5, separation of cannabis and hemp. You know, the statute does allow for a hemp license to be at the same place as one of our production establishments. We're trying to make this again, kind of the communication be a conversation about what's gonna be, instead of us specifically detailing exactly what the separate, we definitely obviously want a separation. We definitely want identification of the different types of products. And really that there should be cleaning on that, before, but we wanted, what we would like to see is based on different types of facilities that are out there, that it might be a better situation to be explained to us versus us explain it or to tell to you, is what we was thinking on that aspect, so. Cannabis extraction requirements, section 6, we're keeping all of that. No changes at all. This was something that was a pretty big deal at the very beginning of the program. By like different safety personnel such as fire marshals and things like that, that talked to you about making sure this is obviously supposed to be for the protection of your employees as well as the surrounding areas and the people, you know, type of thing, just so things don't get overly dangerous. So. Section 7 is the cannabinoid isolate, the ability to bring in stuff from some hemp processors that are low in THC, but so your cannabinoids with a higher amount of that for your minor cannabinoids. Again, no changes there. And 8, the security requirements, some changes there. 1, as well as 2B and 3 are actually covered in statute. Where again, as we talked about, that the video should be where all processing and handling takes place. Again, not necessarily defining those aspects as you mentioned before, JD.
I think one thing that could be helpful, I get it that you're sharing it here in this meeting, right? So I'll be aware of it, and I'll be aware of it. Obviously, Narra's here, but I'm not sure every other licensee is on. Might be worth letting licensees know that like, hey, while we may be removing this from rule, this is still enforceable via statute. Because when I was reading some of this stuff, I was like, I figured that's what you were doing, right? You know what I mean? Because I talked to Anna the other day at the licensing board meeting, so it kind of took me off.
Yeah.
But had I not, I would have been reading some of the stuff today. And you guys are removing a ton of requirements on this, and I would hate for someone to get an inspection and you say, actually, here's the statute where it is. So I get it's not your job to do the homework for people to figure out where it is in the statute, but it might be nice to let people know, hey, as we're changing this rule, while you see a number of things kind of struck through and we're removing it, it's being removed from rule, but it's not that it's no longer enforceable against you, right? You may, and if you have the ability to cross-reference where it's the statute for people to accept it, just letting people know that this doesn't remove requirements, because I can easily see someone feeling that way, like, oh,
Yeah.
I don't have to do this anymore, and then you get an inspection, and then it's a fight between y'all and the operator, you know, during the inspection or afterwards. It just seems unnecessary.
Yeah,
That
no,
was actually, my question was about that, looking like 45 days of camera footage was being removed, but in actuality.
it's not,
actually.
right,
Yeah.
right.
But yeah,
No, 100% with that, and I actually kind of planned it that way because I hadn't had any stress in my life lately, so I might as well just.
Yeah, no, it's on the plan.
And Eric disappointed me in the first one. I thought that was it, but as you guys know, as the statute goes into effect on May 7th, there'll actually be some like changes to that as far as where certain information is, and then we can. That's when we'll start kind of working on that way. But we'll definitely in our meetings and notifications let people know all that stuff. So same type of thing on the security requirements, actually the exact same information we talked about for cultivators. As well as same with the inventory control aspects of it. We did, and when you get to section 9, the one thing to probably keep to point out is removing number 8, as that was actually left over from hemp waste transfers that were at the beginning, and as you recall, we went to the cannabinoid isolate aspect a couple years ago. So same in section 10, same thing with agents. The statute calls out what we're removing, and then we renumber. Section 11, this is, as I mentioned before in the storage, I crossed this one out there in hopes of some amount of input to the, if the, you know, industry, and I can actually reach out to the industry on both of these in the coming days to see what they want to say about that. And like I said, it's not, the list that we have here is not exhaustive obviously, and so, and it does again stay in statute that the facility does need to come up with that with their own, but so it's kind of, like you mentioned, JD, it's kind of, it's in there, but how much clarification do we?
You're leaving the 6 inches on the cultivator.
Well, no, I
Oh,
did
okay.
this on purpose a
Oh,
little bit,
okay.
mostly for my help, so I can remember,
Yeah.
I knew I was gonna be going down this thing like crazy, so it's
Oh,
really
I'm glad.
like I said, it's dependent, and you'll see a little bit more for processors, another reason why I removed it.
Yeah.
And that's because as you guys that are processors know, you're registering with regulatory services as a food establishment. And again, as I mentioned, as a sister division of us, we'll back off of that portions of it and let them take that. And so that's another reason why I did it this way too. So because there is that second look at sanitation and cleanliness at a processor, and obviously there's no testing that's done at a processor. So kind of a couple of reasons why.
I mean, I'm all for add a rule, remove 10, so. I think you're definitely doing that.
I don't know that we're quite to 10, but we're getting there.
Yeah. 12 is the product appearance thing. That is actually the same wording that's in statute. The statute actually says that you can't package the raw cannabis or product in a dosage form or in a container that is, or has to be in tamper evident, and does not appeal to children and does not mimic a candy container, and also is designed to mimic or could be mistaken for a candy product. So that was probably even better language than we came up with in the rule for that, I thought. Moving on to section 13, the processing of a cannabis and cannabis product. So this is what I just mentioned. We had the reference to 21 CFR 111 on there. We've had, there was discussions about adding language of our own to that kind of almost copies the CFR, things like that, or to maybe even putting in, requirements for master manufacturing plans, things like that. And although this is not very in depth, but it doesn't change what is going on for licensees. But it does, and with regulatory services working with y'all and to get things either put into place or whatever the situation is, it doesn't change anything. And we're starting to meet those requirements to make sure the sanitation and product and things that are required by them is being met. And it's not us being overbearing in something that really we're not 100% up to speed on, because we don't get the better training or the training that they get. So kind of an easy way out, but something.
Do they plan to kind of ease that in? Because I know that was one of the big concerns, right, when we were up on the hill this last session was, being subjected to 21 CFR 111. I mean, we put together a checklist of our own, and it's about 30 pages long, right? It's quite in depth. It goes from A to Z. I guess the question is, in the regulatory services not here, maybe we could invite them to a future meeting to help kind of clarify some of this. But I think the concern was, yeah, okay, we can get there, but it's gonna probably take some time to get to everything that 21 CFR 111 required. Do you have an idea of how they plan to enforce it?
For those of the groups that they've had some issues with, it's been more of kind of a warning. So almost like the letter of concern aspect that's going into our statute about getting that into it. They also understand through our conversations with them that there's things that you guys either can't do or don't need to do. Again, kind of going back to the testing aspect of it, there's no need for your companies to keep 2 years of retains on all of your stuff because everything's getting tested by one of the labs, right? So stuff like that. So we can definitely get them here. I know we did have that conversation at one of the processor meetings, but we can get Corinne and
I
Travis.
think it'd be useful for them, even if there's a separate meeting with just licensees, to understand like the big things that they're looking for, making sure that those are all in place. And then as we get kind of through the nuances, like, because some people are not going to know,
Right.
oh, hey, because we get tested, we don't want to keep samples for years, right? Just helping them understand what they plan to enforce,
Yeah.
and then what may not be enforceable, because I think everyone will be, just not sure it happens, but I'm sure they'll be willing to do whatever they should do. But it just, at this point, it seems somewhat unclear, and now we're just going to be registering with them. I know we already registered with them as a free establishment, but as you know, their inspections aren't, as regular, right? Obviously, they have kind of different tiers of how often they come out and inspect. I know they come every time when they do, that they approve a new piece of equipment, but not every time they come out that they do a general inspection as well. We've had that happen where they've done a general inspection and they marked it off. But I think just getting a little more clarity for folks, because I think when you just look at it, it seems like this is gonna be adding a lot more regulation, and it could.
Yeah.
I just think people want to be sure.
Based on our
that's gonna be-
conversations with them, we don't anticipate a major shift in
Okay.
the enforcement.
That's good to know.
So, and we actually will probably see, as I mentioned about our sister agencies and divisions, is that we have actually put a lot of work on them as well. Like you mentioned, when there's a change request, to have somebody come out and do that. So we're taking away from their job. So for the most part, unless there seems to be a major concern, the plan is to almost kind of separate the two and let them do their job on a regular basis, and then, whatever their regular is, and
Good.
we'll do ours and focus.
So they'll be subject to their rules and stuff?
Yeah,
Okay,
yeah,
So
yeah.
just. consider-
I mean, I'm not gonna say that certain pieces of equipment, we won't have them come out and look, but for the most part, that'll
Yeah.
probably ease a little bit as well, so. I'm working on the name change for this, so don't keep it there, because it's not 100%, it's not exact, it's not correct, I should say. But keeping irradiation of cannabis, which is already in the rule, but just adding that last line that says that if you're getting plant product from a cultivator that's been irradiated, you have to again put down the Redura symbol in the statement and things like that. So that's really the only change there. Let's see, labeling pad, this is where it gets into the stuff that we're doing. So again, trying to clarify things over and over again, which just makes it tough when they're subjective. I think so. As we go down this list, the first thing to talk about is clarifying descriptive names. In I think it's 1.3 there, but obviously we don't want recreational terminology in there, as said several times throughout the the statute. So sorry, let me get to my aspect on this. Apologies. Thank you. All right, so yeah, so allowing the ability for a descriptive product name that is the common name for the dosage form allowed there. We've been allowing the common name, and then what starts to happen is because sometimes that common name also goes against what is actually listed in statute as a recreational term. Hash would be one that just came up recently, things like that. So again, trying to just make, again, so it's staying non-recreational. And then the other aspect, which might bring up some conversation, is the use of adjectives to describe certain things, premium flower, other aspects like that, which starts to be more of an opinion in some aspects versus reality. But
Only the Department of Ag can legislate, like, or make rules or own adjectives.
that's right. Hey, I've looked at the dictionary way more like in Alaska than I have in the last 20 years, so.
What adjectives are appropriate?
None.
Not even stupid cannabis?
Well, you could say fire.
Absolutely not stupid cannabis.
Kind of moving on to the down line, there's been I guess, when we did the rules a couple years ago for labels and said that we needed to put a THC label that the department approves, and we sent them out there on the website. Some people have been changing the colors of that, not having that colors extended, like they'll blend in with the colors on the label and things like that. So just a clarity thing that it should be the colors as well that we put in. That was a discussion we had back then. Removing the warnings that are actually already stated in statute, right? So no need to necessarily say that twice. Clarifying down to 6 is clarifying strains, flavors, and terpenes shouldn't be the logo or the brand type of thing. As I mentioned, we have some licensees that they're sending a new label in every couple of weeks and they're changing it, and depending on what we tell them know about, they'll change it to make it work, and then they'll say it's a strain. Oh no, it's a logo, it's a brand, things like that. So just trying to clarify that type of stuff, because it just starts to go on and on and on, where it should be something that can be approved or not approved within a day, to be honest with you. But it just seems to take a long time to get these done because of those types of conversations. This next one is a little addition, and I don't think it's actually underlined, but if you go to the portion on the back panel for flower, it talks about that you should name the cultivator. manual of this one, but we talked to some patients and stuff like that. They do like to know who the cultivator is. So we wanted to keep the cultivation, who the cultivator was, and then also clarify that it does have to say that it's the cultivator for clarification for the patients type of thing, right? So, we're not gonna say exactly how you say it's the cultivator, but if you could say, you know, wholesome cultivation or whatever, or Riverside, I'm sorry, but that just,
Yeah, I already had this conversation.
I don't even.
We will add cultivator. Riverside Farm cultivation.
Well, if it makes you feel better, I got yelled at by a guy the other day because he thinks I'm allowing one of our standalone processors to grow. Because he was confused on the label on that one. So I took him over to Brandon and let him do it. So.
It was a lot of fun.
Good work.
Like, we're focused on adjectives right now.
We had bigger fish to fry.
Something good was gonna happen today and that's it. Sorry to keep going on this, again, subjectivity, removing unprofessional, as it has been an argument for us, saying that it's not unprofessional. You would think that wouldn't have to be, but it has been. You know, down to 18, this is where it gets at, clarifying the directions of use shouldn't be, directions for use, because it does allow. I apologize, I'm losing myself now that I'm stuck on adjectives too. I apologize.
I'm gonna use so many.
And I don't have my readers with me either, so they can be even worse. Yeah, so also removing language that says like the cannabis, so we're on, what would be 15 there that says, obviously, we're removing unprofessional, then we're removing the word that says that a processing facility knows or should know. Because it's just, again, it's the proof of that it is appealing to children, again, siding on the portion that we want to approve as much as we can and go into it that way and only deny if it's surely something, that, is appealing to children. And then the next one, just for you, Des, to get you off of, adjectives, I added sexual and criminal to the other things, the designs and pictures you can't have on there, so.
We're taking all of the fun.
All of
The entire reason we started the cannabis program, the audience just slash in.
Let's see, this is the one that could be, so I put on there directions for use shall not be placed on the product face. Again, that's been something where people have been using, not that the terpenes don't need to be known, obviously it's in statute, the patients need to read things that people are using that in ways and actually using. Also, I'm sorry, it's not terpenes, it's strains. I'm talking about strains that aren't necessarily proven to be what that product is made from and using as the big thing on their logo or on their brands and stuff. And so we wanted to more put it in a location more similar to medicine where it's not the thing that, because we allowed it to be a, directions for use of that, if they don't put it on there, say it's bigger than everything else, so we get to have it on there, type of aspect. So again, unfortunately, this is just issues that we've dealt with. Just to replace the cannabis cultivation thing that Matt talked, or who the cultivator was that Matt's not happy with me yet. I did add any of the warnings required in the chapter or the law can be put on any of the labels of any product. So if you want to put the overconsumption one from gummies onto some other things, it could be on there. It would be up to you as the processor to do it. It wouldn't be required. Obviously, there's some that are required, but we're not going to keep you from doing that in that aspect. Removing the dates. I should say this as I'm talking about this. If this stuff goes through, we will put a future date on it. We'll work with processors to make sure that it doesn't affect labeling, because some people do have some things that might be there, but there's going to be a handful that have a lot of problems we deal with. But and then the last thing would be that just, you know, no shoes, no shirts, no bid, no service type of thing in number 20. Just to hopefully, but like I said, the whole point of all that is trying to make it so we can enter into that conversation with the hopes of improving something and not denying. So I apologize for taking so long, Matt. Transportation, again, removing that portion because it's a statute. recall protocol, keeping that. Cannabis waste disposal, we'd like to remove that based on the language and statute that I don't believe we're meeting, and it will take some research, as Diddy pointed out, on both sides to make sure we all are meeting it. Changing operating plans, really a clarification on one towards the bottom that said, it used to say change the number of production lines. We've split it up to also be processing extraction equipment as well as new products or dosage forms. There just to split it up because everybody we asked didn't know which one we were talking about. And then two, removing the board portion of that because not everything needs to go to the board for approval, but you more than likely need approval for an operating change. So it'll just cover both. It could be done by us or it could be done by the board depending on what it is. Renewals, the same type of thing. I'll check on what that section as well, but just again, to have licensees, you have to be there anyway, according to statute. And to have you guys actually talk about the things that are required in statute for renewal. And then have the department there with you. The one question I would have, I struggled on the amount of days before license expiration to have the notice of renewal put in because as you guys know, there's sometimes our meeting, you're 60 days out before you expire and sometimes you're 3 weeks out, right? Or even sooner type of thing. I don't know if maybe I should just remove the days anyway, not take any input there on it, but just say it has to be, maybe keep it as by expiration, but obviously we want it beforehand because we got to take it to the board at this point.
Well, isn't the date? You've set a date as far as submitted material to the board. I mean,
So we could do that. We could say.
So, yeah.
I like that. Targeted marketing, no changes at this time. Violation categories, the same thing as with the growers, no changes because we're supposed to make rules on that. And with the LOC, it'll still be there, but I think, and that is the processor rule.
So the department's understanding of the website that's allowed for processors is actually advertising and not targeted marketing.
Based on the language and statute.
Okay, so it doesn't need to be age gated, doesn't need any consent to receive the
It
information.
can have
It's free,
no
just be
promotional
a
stuff, yeah.
Wide open.
Well,
website.
yeah, and it's just no promotional
Yeah, of
stuff.
course, you can't violate the other advertising requirements.
Right.
Right to my YouTube.
Yeah, so it's pretty specific on that one too, so.
I think that's an unintended consequence. I don't think they.
Oh, there's several on it.
That was our conversation we had with us. We can't already allow.
Oh, yeah.
Via targeted marketing, I mean, was it not? And now, the way I read it is it's advertising and not targeted marketing.
Yeah.
It's interesting, they can have a product on there as a processor.
I'm not the
We
kind,
as a
JD, to tell you I told you so, but
Yeah.
it's been a dog enough years of.
Sounds like we'll clean it up in 2026.
We'll be back.
All right, well, appreciate it. All right, well,
He's got another one.
well, I know, but Aaron, do
Well-
you have anything you want to say or are you good?
No,
Guys,
Scott Erickson.
I don't think we do have what?
Scott
Okay,
Erickson.
all right, well, we'll take, we do have an online comment. We'll open up time for public comment. Scott Erickson, you have 2 minutes.
Okay, can you guys hear me now?
We can't hear you,
Hello.
Scott.
Okay.
Do we have volume?
How about now?
Yeah, it's part of your audio output.
We didn't want to test. Yeah,
Is that any better?
started too quickly. I apologize. Scotty there?
At least we got an echo.
All right.
Oh, they can hear him online, but we can't hear him.
Could they text you what he's saying?
You're close
I'd say
caption.
this might be the best meeting yet.
You're closed
My
caption.
middle name Call him and put him on speaker.
I could unmute him on my laptop.
Yeah, you can
If
do
you
that.
want to mute the room audio, Scott, if you can. Scott, if you can. Oh. Yeah, this is.
That any better, guys?
Yes, we can hear you.
Okay. I'll text Cody about it, or call him, but really health is moving towards the using email and text and inserts for patient information. With limited space on packaging, it would be great to allow some of the warnings that keep getting added every year into some kind of an insert rather than being on the bottle, to try to keep costs for patients down and costs for packaging down. The more of those that get added, the harder it is to fit things onto packaging. So I don't know if there's a way we can get there, but it would be great to figure out a way to include some of those warning language in a different form. I know in other areas of the department, anything that is on a website or an insert is considered part of the packaging. It would be great to include some of those wording labels in other areas so that we don't have packaging that continues to grow in size.
All right, thank you.
I'll allow JD to put that on his 2026 fix list. That's all that'll be statute.
Okay, all right, we'll continue on to our
And I think
six
with the change you guys are proposing about where, right, you know what I mean? Means it can be, you know, at least for the time being, you know, they're not going to put on the fact panel if you need to, right? Whatever. But I do think it's some point, some of those, and it might be worth talking about lawmakers, like which ones do you really want to be on the packaging, and then which, for instance, could go on, you know, a product insert, you know, I mean, depending on how many more we plan to add, it seems like every year we come up with a new one, because someone comes up there and, you know, makes some claims, but, you know, I just think it's more sort of cost of it, right, every time you have to replace packaging, but now you guys are gonna allow it to go kind of anywhere. But then again, you know, you get concerned about, you know, you call specific things out, you know, there are certain places, so.
Yeah, and just for clarification, right, I mean, there are still, according to statute, those certain types of products that require certain types of.
Yes.
Of warning,
Yes.
so just for that clarification for first. So.
That'll be lower.
Bring them back to us.
Matt, I can save you a little bit of time right now on R66-3 if you'd like me to.
I mean,
One to play change, right?
I'm actually holding off on the rule.
oh, you're gonna do it next time?
Yeah, apologies for that, but we had a meeting today and some information that came across the last couple of days, but they're based on the possibility of adding some terpene requirements to it, to the rule, as well as some continued complaints about mildew and mold and flour. We may want to be talking to the industry about possibly adding some limits and stuff to the rule on that, so.
Are you guys, when you guys get complaints, are you guys collecting the product and doing your own testing to verify the pictures?
And we are verifying that it is a problem.
Yeah, what, in terms of, like, obviously the TYM standards across the country vary greatly. We don't have a TYM standard here in Utah, we have a general microbial standard. Do you have an idea of where you see this going?
I could throw a number out there, but honestly would like to hear from patients and from industry partners as to what's realistic and what's offensive to patients. You know, I don't use cannabis myself, cannabis flower, and so I don't know what it tastes like and what is too much. So we really do want feedback from patients and from producers. We understand that it's very hard to guarantee that there's no mold present in flour. It is a natural product that's grown in a greenhouse. There's always potential for there to be yeast and mold in these types of products, but we do want to set some kind of reasonable amount.
You guys are also still doing your other testing for farm.
For aspergillus, yes.
Right, too.
Yep.
Because I think one of the things about the TYM, and this is not me saying that it's acceptable for cannabis to have any mold or anything, I'm not saying that. What I'm saying is those types of things, as well as the total microbials, it's hard to, more so with microbials, it's hard to know what's a beneficial microbe versus what's not. And they've just gotten to a place in certain states with some of the limits that they've set where you cannot get flour into the market without irradiating it. And I'm not sure that's the route we want to force producers to go down as well. But I also agree we want to promote, you know, as clean cannabis as possible. So I think the fact that you guys are going to think about something like that, I think that definitely deserves a lot more discussion.
Yeah, we agree. We want discussion on this item, so please talk to those that you represent. And let's get a good number to put out there. We don't want to rule with an iron fist on this necessarily. We just want something that will protect patients, but also be realistic for the industry.
So given that you guys are going to make a change in this rule around final package testing for flour, are you just going to hold that until you do the rest of the rule?
Well, if we can get the other parts done quickly, I think the terpene thing will be fairly quickly if we decide to
Do
go.
you anticipate bringing this rule back in front of us next month?
Yeah, just because I'm not gonna mention the other things that are in there at this point, either we'll get the whole thing, but if by chance that there's, you know, we don't get to a point where we can agree on, we can pull what we have in there and bring it, I mean, we might have to open it up twice. We'll get it done to make it work for the.
Do we need a motion to table this till next meeting?
That's just a draft review.
Yeah.
That we do, so it's not.
Okay.
Yeah.
Other than that, I apologize for taking that much time, but I also appreciate the board's interest and feedback.
That's right. We appreciate the effort put in to make the program better. With that, we will go ahead and move on to the first, our item number 6, patient product information insert summary, and I'm trying to time over to Mr. Owen.
Yeah, Abby, are you able to present a copy of the,
I have that ready.
oh, you do? So do you want to present it?
Yeah.
Okay, great. Thanks, Trevor.
You want to go straight to the definition?
Yeah. So the purpose of this agenda item is for the Department of Health and Human Services to get input from stakeholders, including the board, regarding a patient product information insert legal requirement that's new. And so if we go to,
Sorry, just finding the right Zoom here.
yeah. So this shows the language from the statutory requirement where it defines what that product information insert is. And as those joining from somewhere virtual and in person, you can look at the screen and you can see how it means a single page document or web page that contains information about a medical cannabis product regarding how to use the product, common side effects, serious side effects, dosage, contraindications, safe storage, information on when a product should not be used, and other information the department deems appropriate in consultation with the cannabis processing facility that created the product. So our plan to implement this is and there's actually a separate part of the bill that requires that DHHS create the insert, right? It says that we need to consult with processing facilities. But we are creating the insert, and there's that language there on line 2839. Department is to develop patient product information inserts for medical cannabis products in consultation with cannabis product processing facility that created the product and that do not contain proprietary information about the product. So as we consulted about this internally and got some feedback from processors and pharmacies, it seemed like in the first phase of doing this, and when I say first phase, that means May 7th forward, and then we could do a second phase where we do some more detail. But at least in the first phase, we felt like we already had language on our website that covered the topics that are the minimum required to cover. And so that's being presented now as important information about medical cannabis. This is something that we actually put together with help from the Cannabis Research Review Board and with help from medical providers throughout the state. And also with some input from processors and medical cannabis pharmacies. And the language that's being presented now is under review because we did feel like there's some adjustments that could be made based on some feedback that we did get from processors earlier this month. But the bottom line is that if someone is new to medical cannabis, of course, super important for them to have information that is easy to read and understand about the product generally, right? And then specific information that a pharmacist or a pharmacy agent may want to explain about a specific product can be provided at the location by that specific employee that's meeting with that patient. If they're talking about medical conditions, of course, that's conversation that would need to be specific with the pharmacist. If they're talking about their specific experience that the patient, then they would need to talk that over with the pharmacist. But this is just a place where patients and medical providers could go to learn about some of the general basics about medical cannabis. How do I know what dosage and products to use? What are some of the common side effects of cannabis? Can medical cannabis interact with other medications? Are there risks to using cannabis? Can I become addicted to medical cannabis? Will I have withdrawal symptoms if I stop using medical cannabis? Will medical cannabis make me sick? Is it safe to smoke or vape medical cannabis? And then it goes through, how can I be safe with the product? What does it mean to start low and go slow? Emphasis on waiting to drive after using medical cannabis, storing it safely, and other important topics. And then when is medical cannabis not a good treatment option? It goes through some of those scenarios where it may not be a good option for individuals. So this is intended for patients. So written at a reading level that a lot of people could understand. And we don't want to be scientific in it. There's, as you know, a lot of scientific information out there about cannabis, and there's a different place for that. This is for patients to be able to understand some of the basics. So in this first phase, we're looking for input about the content that was there on the website. And then a second phase we were wanting to implement. We're not sure exactly when this would be based on how long it takes us to put it together. But what we want to do is to include some specific information about the dosage forms or the method of delivery, right? So we've got oral, we've got inhalation, we've got a few delivery methods out there. And there are some specific information related to onset and with gummies, some specifics that we felt strongly that it would just take some time to work those out. And so that is planned for a phase 2, where we could get into some of that detail. But at least in this phase 1, we know we're meeting the requirements of the statute. So, and we know we have this deadline of making it effective by May 7th. So now is the time for board members to share any thoughts they have about the current important information about medical cannabis that's posted on the webpage. And we're happy to just listen and talk through some of that information. And then after that, maybe if the chair would like to allow stakeholders to be able to share their thoughts as well.
I have one specifically about the language, using the term side effects. I actually mentioned this in a previous CRRB meeting. They're not side effects. They're just effects. They're known effects. They're undesirable effects. They can be mitigated if used properly. So using the term side effects doesn't actually describe what you're experiencing.
So you'd recommend that it say effects
Undesirable.
or undesirable?
Sure, but
Okay.
yeah, or I don't remember what language they ended up settling on, but they actually decided to change all their documentation.
Yeah, I think they went to unanticipated or.
Yeah,
Unintended. Well, it's
Something,
intended to take it, right?
Right,
Like,
but
you should
it's-
intend, right, to, is where we.
I can't remember what but you're
I
right.
can take a look at that. And also, it's important to keep in mind in like a regular FDA approved product insert, how do they say it? As well, because there's effects to those, just like there are to medical cannabis, right? So what are patients used to seeing when they read about a FDA approved drug?
If you have the education, that you will experience those, right? So they're not always going to be an effect of cannabis. They're not an effect of every cannabis product you're running through.
Sure,
So not every person's gonna even experience that same side effects depending on the method of dosage that they're taking. right?
Yeah.
So it's not.
What is the definition of like a side effect though, then Misty, because like, if you were taking. An opiate, then you could have these side effects to be watching out for.
When we actually use some of those side effects. If you look at it, like antidiarrheal effects, so I think it's what is the intended use. And if there's something other than the intended use, it's an off-target effect or an unintended. I mean, there's different ways to verbalize it, but. The thing we use in one person's adverse effect could be another person's intended effect or desired effect. So, I mean,
Yeah.
nobody wants a prolonged QT interval, for example. There's some are life threatening, so those need to be treated in a different manner than others. So yeah. I think they did settle on something. I just can't remember what that was.
we can track that down and also,
That's been 3 months ago.
Yeah, I think it was.
Yes.
Yeah.
It was not this past one, it was the previous.
Yeah.
The FDA uses the term on those legally required package inserts. What are the possible side effects of drug X? And the website right now says, what are the common side effects?
Possible.
a phrase we're considering adding to the current language is different cannabinoids may have different effects. Right? And we know that's been proven. Also, some products contain other cannabinoids like CBG and CBN. Different cannabinoids will impact you differently. Products that are high in CBD will have different effects than products that are high in THC. Talk to your medical provider or pharmacist to learn more about how different products will affect you.
That's the key, that last sentence.
And administration, like, we talked about over 65 adding more ER visits. I
want to bet that it's because they're taking edibles and having an undesired experience on that.
Amplified.
Yeah, there you go. There's a better word.
Yeah, so that language that I just shared is just in a draft that we're working on, and when we have a final draft, we'll of course share it, but those are some realities we're trying to incorporate into the language.
Rich, is your intent on May 7th to have just a website for the pharmacies to have printed? To go for these product inserts? What are you? A QR, well, or something.
That to me is.
Well, something needs to be printed, whether it's a receipt or whatever. So however they're gonna get there. And so you're just gonna have basic dosage forms and then this educational thing we just went through.
Well, the dosage form language is going to take us longer. That's in a phase 2. So we won't have that ready in time for May 7th. But Department of Ag can speak more to the topic of exactly what their expectation is for how it will appear at the pharmacy. And I don't know, Cody, if you want to speak to that topic a little bit, but there's some language in the statute that talks about it, if you want to go through some of that.
So the idea is in order to meet the statutory requirements now and the deadline, it's gonna be a little more generalized information about cannabis generally.
Yeah.
The second iteration is to get down to the form factor level.
Mhm.
And then I'm assuming there's no intention to ever get down to the SKU level, right? Probably just form factors as you guys will get with it.
No, but one thing that's true is that we are consulting with processors and pharmacies and industry about this. if there's ever,
You know, I'm not-
a
I'm not saying I
preference,
have a
you know, you
plan
let us know,
preference
but-
one way or another.
yeah.
I'm just trying to understand where the iteration goes to, because
Yeah.
I think at the form factor level, you probably get about as much as you'll need. But I think some processors are gonna feel differently, especially those that are big time into ratio products and
Mhm.
stuff too. They're gonna want, because they heard what Blake was speaking with you about, well, that's relevant to THC, that's not relevant to CBD or CBG.
Yeah.
So I think it would be good to, at some point, even if you go to the form factors, to maybe, if, you know, some iteration of this gets into the different cannabinoids, because sometimes what might be an effect of one can be counterbalanced by another, or be a different effect. So, but I get it, the main component of what's being sold when you're talking about the cannabis program is THC, so it
Mhm.
makes good sense. But for me, I think it's more so the execution of it, so if it's possible, and I talked to Sarah about this, if it's possible to do a QR code that we can attach somewhere, either to a physical document, I doubt many people are gonna wanna do, other than like a receipt, I don't think I'm gonna wanna print thousands of pieces of paper that we have to hand out with everything. What would be nice is to have a QR code that just links to this information, and then you guys tell us where it's acceptable for us to place, but I think the statute kind of already probably says, I think the plan would be for most people to just put it on the bottom of the receipt, and that's kind of where the insert information would go. Because the idea of trying to text message, email this all the patients at the time of purchase is just gonna be super messy. I appreciate that the legislature gave that as an option, but I think the preferred way to do this would be a QR code, and then we can figure out where to put that QR code. If people want to take the time to print a bunch of 8.5 by 11s and have those available to register, all more power to them. But if we have the ability to add them to our receipts, and I think we do, I think MJ Freeway's always given us the ability to add and remove things from the receipts. I think that would be the most likely place for operators. So if you get to a place where you're wondering what operators are gonna do, I bet that's the most common thing.
Mhm.
You guys can have that information for patients, because patients may be thinking they're gonna get the traditional insert, like when I go to Walgreens, you get that extra paper with it. But as soon as I open up my bag, I need to say this, that, and it goes into the garbage can, you know what I mean, that type of stuff. I think it's just easier to put it on the QR code, and they can access it if they want to, or, so I think that's kind of.
Is the intent to have one site? Like-
Yes,
I mean, I don't want to be burdened
You know,
to
one
to one QR code, that's it, because to have to find out, you have to have 5 different QR codes for the 5 different products you just
Well,
ordered.
and
No.
what you were saying too. is because
we don't
there's
want that. Yeah.
Sometimes, and we've used at different times a QR code for other stuff on our receipts.
Yeah.
So what we would do is we would probably just say, hey, for more information on medical cannabis, you know, access this QR code, something like that, right? And, or you could get as, you know, specific as to access the patient product information insert, that's the right term. You know, go here, you know, something like that. That's just gonna be, I think, the easiest for operators. And if we are required to have paper, I want DHHS to drop off some. For us.
They're like patient card, like a QR code.
Yeah, it's a, yeah.
So I will jump in just a little bit here, and I don't think the Department of Ag has any issues with what you guys are saying. I think one thing that we are kind of concerned about is making sure that every type of, or at least the majority of patients have the ability to see what they want to or need to see on this type of thing. And a QR code may not work for everyone. So one of the things we were thinking about was requesting that to be put in a pharmacy's operating plan and almost base it like
How we'll handle it.
yeah, kind of thing. And like I said, I mean, there might be an elderly guy or woman or person that comes in, maybe it has a flip phone. I don't know, I mean, stuff like that. So that's a one-off maybe type of thing, but that's some of the thoughts we've had. But it really is kind of, I mean, it is allowed fairly, you know, as you guys said, physical docs.
Gives us the option, right?
It gives you the option.
To me, that's more of a customer service thing than necessarily a statutory thing. I'm mindful of that too.
Yeah.
The patients want this information.
I think the ways that you can, I mean, obviously they think you have plenty of options to get it to the patient. So if it's a one-off like that.
I just think one thing would be nice though too, is if there are gonna be instances where patients come in and ask for a paper copy, that you all provide us some sort of digital PDF that we can.
Yes.
Print out to the patient, and that would alleviate that, because I just don't wanna have hundreds of those, you know, you have to print them all the time. So if we use a QR code and then that's something you can send us a digital file of, I think that'll make it a lot easier.
Yes, and that's something that we're putting together now. It's just one page, double-sided. It has our logo on it. And it'll include a QR code and a web page address to where someone could go. And we'll send it out to all the pharmacies and the industry so everybody can see what that looks like.
And it'll still essentially contain that same information in written form.
Yeah,
I think
but
that's the concern, right?
it's just a shorter version of what's on the website.
I got you. Okay, so they'll at least meet the statutory requirements on paper, and then if they want the longer unabridged version, they can go to your website.
Yeah.
That sounds good to me.
Right. Yeah, that's how we plan on doing that. Yeah, so the actual QR code and the webpage address will be sent. We're just finalizing that this week, and so we'll make sure that everyone has that to incorporate into their materials in time for May 7th. There could be topics that are not covered in the current webpage that you want to be sure are covered. If those come to mind, reach out, let us know. Just because it's not listed in the statute, it doesn't mean it can't be required. The department has the ability to require additional items beyond that which the statute specifies. It just may not be in the phase 1 version, right?
Yep.
So,
When do you guys envision phase 2 going into effect? You think that's gonna be?
I think a reasonable target is July. Yeah, because it's going to take some time to go through. One of the keys, as we all know, is to make it evidence-based, right? If we're going to say something in here, it's going to have something that backs it up somewhere. So we'll be able to, in the industry, we'll be able to say, you know, if you have questions, contact the HHS. They've verified the information they're sharing, you know?
Do you guys plan to provide any sort of sourcing, you know, on your, on the statements you make on the website, like basically a backup for it, like what your side of your evidence base, you know, data is, or where you can find that?
I'll consider that. It's a good question.
Maybe just a footnote.
Yeah, we try not to make the document look too busy. And so there's different ways to do what you're describing.
Well, maybe that's just
Yeah.
online,
Mhm.
because you'll put in there for more information, visit here, right? That-
Right.
So if you look at the.
Oh, yeah.
Yeah, yeah, yeah.
We are claiming all of this stuff as evidence based.
Yeah, let's see the evidence.
That gets your citations.
Yeah. And one place where we do have a lot of citations is the suggested use guidelines specific to each of the conditions. And then that work of the Cannabis Research Review Board also has a general document. And that's where we've gotten a lot of what we're saying here is from those documents that have been created. There's some general use guidelines where a lot of it is taken. It's just written in a more simple way and easy to understand way in the other section of the webpage that we're creating.
There are 114 citations in the general use guideline document. So
Yeah.
as you can imagine, it get loaded very quickly.
Yeah. And then I thought you remember saying during the meeting with processors that you wanted the feedback like this Friday, is that correct?
Yes. Yeah, just for the first phase, right, as we finalize what that language will be. And one piece of feedback that we did get was, hey, this seems to be just like 99% heavy in warnings, which a typical insert that's how they read. But at the top, typically they will say, okay, this is what this cannabis is used for. And so one possibility is something that just says generally, I'll just read from some draft language we're putting together. Research shows that medical cannabis may help with treatment of some medical conditions, including chronic pain in adults, chemotherapy-induced nausea and vomiting, and multiple sclerosis, spasticity, and symptoms. It may be given to you for other reasons. So we leave that open just because we know there's some other reasons that medical providers do recommend.
My understanding of product inserts in general is I know Utah law says we can't contain anything that's proprietary.
Yeah.
But my general understanding of them is they cannot contain marketing, right? Like,
right.
So, I mean, it's understandable why you wouldn't be able to put some of those things in there that maybe a processor or someone else might want. Well, it could be true, you know what I mean? It could even be evidence-based. They can't market the product. So that's always been my
Wouldn't
understanding.
you want to just put all that emphasis we can recommend for?
Yeah, we want
Right,
to say,
put out there so that they can see their
The
like.
qualifying conditions.
yeah,
That's.
they can, you're used to treat a fall qualified condition.
Yeah, there's a lot of, I think there's 18 there. And just one of the realities of how those got on the list. Some of them aren't that scientific, I'll be honest.
Blame the federal government.
And the Cannabis Research Review Board has been clear about that in their review. But if you look at where there is some consensus and substantive and what they call substantial evidence, it's those 4 items I mentioned.
Okay.
Yeah,
And you do leave it open to say other conditions too, so.
right. Yeah, that's,
On the, withdrawal symptoms, or they can use the sick, you have any plans to put like mitigating solutions there? CBD is really common for people who want to use if they're trying to convert a person's like THC, it might be a good fix to run for something like that.
yeah, we've thrown in there, stop using medical cannabis and talk to your medical provider right away. And medical provider could be a pharmacist at the pharmacy. Sometimes it may be difficult to get a hold of the single one they might have met with at a clinic, right? And yeah, there's always this challenge of more description and trying to keep it simple, right? The language, because it can be intimidating when you see something that just goes on and on and on. So
It's been very case by case basis.
Yeah.
The safest thing is to say, solve your medical provider.
right,
It's gonna be the safest thing that all of these things should direct you.
yes. Right, something that's a little bit that we're also considering is the phrase, if you go to, are there risks to using medical cannabis? These factors put you at higher risk for cannabis use disorder. And then the first one currently on our website says you're younger than 21 years old. And we are considering changing that to you're younger than 26 years old. Based upon the studies, that's at the brain development period. So anyway, that's why we thought that what might be good to change. And then under, are there risks to using medical cannabis? Can I become addicted to medical cannabis? Some people become addicted or dependent on cannabis. This is called cannabis use disorder. We're going to add the phrase, talk to your medical provider or pharmacist if you have questions about cannabis use disorder. So again, directing people back. We felt like that phrase would help with that.
I think that's appropriate.
So,
I mean, I know the DSM-5, right, obviously.
Yeah.
and this is what it-
That's way above my pay grade.
Has it changed
You don't
over the
love the
years?
DSM-5?
Yeah.
Is the definition ever changed?
Yeah.
Yeah.
Have they added more things to it? More
It's
symptoms
actually
that-
become more simplified over time.
Yes.
And, you know, more kind of easy to differentiate rather than more complicated.
It used to be very vague and a lot of different things could fall into that
So they
definition.
made it more specific over time. It's complex.
But also like more, less subjective. I guess.
Yes,
Okay.
yes,
Yeah, like these more measurable tick boxes.
yeah. Give me these criteria to fall into this.
Rich, do you have anything else to present?
No, so yeah, the deadline where we're hoping to get input on the first phase is Friday. So if you do have comments, if anyone on the board or in the public,
Last one is the.
Yeah.
Wait at least 8 hours after using, and just follow the link that doesn't say anywhere, but that's a recommendation by the CDC, is that. We have a source for that somewhere.
we can track that down. Yeah,
Can you mention again where you found that?
Way to drive after using it.
Wait to drive.
Then at the very end, they hold it, it says wait at least 8 hours after using it, before driving.
Yeah, we'll track that down and just email it to the group, so you have that. Great.
And again, that's gonna,
Depend on the person.
Yeah.
And the type, because like,
The job secure.
yeah, consumables is very. More.
Thank you very much for your presentation. We look forward to further information in the coming months.
Great.
If there's anything else, we'll go on and turn some time over to Ms. Hennessy, who's put together a presentation. 5 minutes and get back on schedule.
Yes, actually, this one can,
I know.
I cannot do a Cody and I can get everybody back.
Was you using that as an adjective?
Is an adjective. So, okay, so the first one is removing background checks for caregivers and guardians. You guys remember a year ago tomorrow, we went over this and in more depth than we're going to today. So currently the background of this, if you want to be a caregiver, you pay about $68 for the application fee, plus you're paying about between 5 to 45 for fingerprinting, just depending on where you go. So if you have somebody that you're caregiving for, your out of pocket every year is about $100. So I run into that often, and just different ways that people are trying to circumvent that, right? Like, so, and then the time to get background check during COVID was ridiculous. So that was also one of the reasons why we talked about this. But last year we voted unanimously to kind of just have people attest that they had not been charged with a crime. So we're just kind of going to go over that again. So we have 6 states that require background checks for caregivers. Utah, North Dakota, South Dakota, Mississippi, West Virginia, and Pennsylvania. And then others apply background checks only in specific circumstances or rely on criminal history disclosures without requiring fingerprinting. One thing to note is that we do have, as of last year, we have 374 active caregiver card holders registered with the Department of Health, and I can find out and Rich can clarify if I can find no reported or known issues related to caregiver misconduct.
And have you ever had any caregivers fail the background check?
Yes, I'll confirm that, but it's gonna be less than what I could count on a hand, but yeah, most of the time they will just filter themselves and not apply because they know. Right.
So that's kind of what we're looking at to do again, is just, revisit this, see if we want to reaffirm or renew this recommendation that we would eliminate the caregiver and guardian background check requirement, replace it with a self attestation, like for just that they would just say, I have not been convicted of a disqualifying felony, so those would still be listed, or a drug distribution. Waive the $15 cart fee. And then our last proposal was take it down to the $5 caregiver, and you could add that on the patient's application is what we had originally asked. We're taking that down to $8 now, so we could talk about adjusting that if we wanted to. The card fee, right, is going down to $8.
I believe it's 10 for a caregiver.
Going down to 8.
Is it? So, maybe we just unify that instead of how at 5, or maybe we keep it 5, like we voted last time, but
Wait.
basically, just trying to make it more accessible and affordable and promote honesty in people that are being caregivers. And so they're, see how many people are caregivers and we can treat them accordingly. So anyway, the conclusion is just, we like to reaffirm this and resend it to the lawmakers saying that this is what we vote on.
And just a little bit of research that we did while you've been speaking, Des, is first, there have not been anyone that has not passed their background check as a caregiver, so they've all passed. And then also we did research about the fee related to the caregiver renewal and initial, and the fee that we keep for just the card fee is decreasing from $15 to $10, not $8. Yep, the $8 is only for the patient card holders.
And have you guys ever, revoked the caregiver's card?
No, I don't know.
I know one.
Have there been any complaints about caregivers?
So maybe one, but we can, research that, but
Now, question for Des. Is this so you're looking to propose the exact same thing we did a year ago? Or are you changing?
We just wanted to, yeah, no, we're proposing the exact same thing. We're just re-saying, hey, this didn't get managed last year. We still as a board, do we still believe that this is a way that we could cut costs for caregivers? I do get this complaint often about the caregiver hurdles and the cost. And so is this something that we still believe in? Do we want to give it the thumbs up again and pass it on to lawmakers?
So to keep the conversation going here, is I was looking at the other states that have different requirements. The one that kind of stood out was Arkansas, where they're required only for non-parent caregivers of minors. That one kind of hit home a little bit when you start thinking about care of minors that are not your legal guardian. Just curious, I don't know how many are in the system that are that way. I would assume background checks would include sexual offense registries, stuff like that.
Well, the other thing I wanted to bring up is a lot of times if you are caring for someone, you may already have a power of attorney, a medical and legal power of attorney. So that I'm in that situation with my mother right now, and I don't have to go have a background check. I don't have to get any other even controlled substance prescriptions. So.
And all of our minors are seen by the CRRB as well. And so they have the quote unquote like caregiver working with the CRRB and the doctors to get them through that. So I think that they're closely tied here.
Yeah.
When talking about minors, we have 76 patients under the age of 21 as of March 31st. So they all have to have a caregiver.
What, so not 37 or something?
Well, under 13 is 17, 14 to 17 is 20, 18 to 20 is 49.
Yeah, at 18 to 20, you don't have to have a caregiver.
No.
Right, you're over 18.
If you go through, you don't have the caregiver, so it's 37 total patients that are for minors.
And that's, not even accounting for how many of them are their caregivers that aren't their parents.
Right.
Right, so that's a small.
90%, if not 100% will be their parents.
Yeah.
Or some sort of.
I think we're more often talking about elderly than, than you.
Certainly, there's a concern on this, that, when you're going through a background check, you may self-select yourself out.
Yeah.
I think having that self-attestation is still,
It's still
encouraging and all that.
It'd still be subject to perjury.
Exactly.
The threat is the same. I think they would still choose to not. So.
And I can understand, I mean, if Richard just reported to us that they revoked 50 caregiver cards.
Yeah.
They determined that there was some sort of caregiver ring.
Caregiver and drug ring.
To the product, so I can understand having a bigger concern over it. But to me, this just seems like another way to stigmatize cannabis, because as Misty just said, right? She's allowed under, a legal document, a legal power of attorney to do all of that stuff, for an alien family member. But now, because it's cannabis and, for whatever reason, we've decided that deserves an extra layer. So I think we made a good decision the last time around. I guess the question is going to be now, for me, is, I wanted to ask you guys, Rich, that $8 or the $10 fee you guys receive, outside of the background checks, what else are you doing in relation to a caregiver? So I think the reason why I'm asking is would you guys have enough things to cover your administrative costs if it was just part of the patient's fee? Like if only patients were paying for cards and caregivers weren't paying an application fee, you guys, would there be a shortfall for you all? So does there need to be some fee from your perspective?
At all. So
So there'd be no background check.
There was just $10.
There's no $10 fee.
Yeah.
Waive the fee entirely for caregivers. What would that do to you all in terms of a shortfall?
Well, there's some software support that we do provide. When someone is issued a caregiver card, there's an issuance of an actual card that person gets, okay? So in essence, when we charge them the card fee, we're charging them for that service, okay? And yes, lawmakers could choose to make it so we just don't.
Charge that fee.
Yeah, just like they did with QMPs and say, no, we're not charging the QMP fee anymore. Right, that begins in July. Although part of our most critical software piece is supporting medical providers as they get access to the software, right? But we cover that with other fees like the uniform transaction fee. Also the medical cannabis card patient fee. So this is not a major source of revenue. So it's not a major concern.
Do you know how many patients that have caregivers, the caregivers applies within, I don't know, a day of them getting their card? Like, is that typically how it is? Like, I mean, I assume if you're a caregiver, a lot of them are probably helping the patient apply for the card.
Yeah, they wouldn't be able to apply without a
Yeah.
caregiver.
So,
They're usually waiting and takes time for them to go get fingerprinted and then they have to get the results of that.
but does the patient have to apply for the card first? And then they apply for the caregiver? Or can they do it in conjunction?
I believe they do it in conjunction, but I can research and let you know.
The QMP on the application would state whether a caregiver is needed, so it would be part of the same application.
Which is why I think last time we talked about just saying, if you need a caregiver, we'll just charge you $5 extra, because some of them it isn't a family. It's not, it's a neighbor that's going to be there to get the meds when they drop them off, or, and manage that. And so, and we just said, maybe it's a $5 caregiver add-on fee to the patient's application.
And what's the patient fee went down to $8? So that would be a $13 fee now.
Yeah.
So $2 less than the original fee was, if you want to have a caregiver.
If you want to have a caregiver.
Yeah, I mean, personally, I think we should just recommend the legislature entirely, but like I said, yeah, that's my thoughts.
Well, you can make a motion.
I know, yeah, not yet though. Not time for a motion yet.
Okay. Do we have anything else from the board? Any other questions? Do we have any public comment online? Or in the room? We'll open it up. Room's pretty quiet. Online is quiet. All right, with that, we'll bring it back to the board.
And I guess the only comment I would make, to Missy's point, you don't even need a power attorney to go pick up hydrocodone for my brother's open arm.
Right.
Yeah.
Just walk in, driver's
License, yeah.
That's really what we're talking about,
Yep.
What's more dangerous,
I do that.
hydrocodone, opiates versus.
Wholeheartedly agree, yep.
So.
All right, well, with that, I'll look for a motion. You ready for the motion? I want to eloquent. But simple, because we're trying to catch up on time.
Well, if you want it simple, brother, I ain't your guy.
That's why I would like.
Mr. Chair, I propose that we recommend to the legislature that they remove the background check requirements for caregivers in favor of an attestation that they have not committed a disqualifying felony or drug distribution offense, as those terms are defined in Utah's medical cannabis laws, and that they waive the application fee for caregivers.
Second.
Wow, quick on the draw.
It's been seconded.
Just maybe one question, there's a caregiver and guardian in the proposed changes, does it need to be both or just caregivers fine?
I would recommend it be specified both because that makes it really clear. So they are two separate fees.
Alright, so I amend my motion to include both caregivers and guardians. All right, thank you, Mr. Anderson.
Seconded again.
And it's been seconded by Misty. Did you get all that, Abby?
We will in post.
You just read it back and then it's
We're gonna figure it out.
So.
Matt's gonna get mad.
Yeah, she's gonna read it back.
I have, I'm recommend to the legislator to remove background check requirements for caregivers and guardians.
And so to keep the existing disqualifying felony drug distribution offense in the past 10 years, And the misdemeanor drug distribution offense after December 3rd, 2018.
Is the felony a felony ever? Or is it just within the last?
Felony within the past 10
And then
years.
it's a drug distribution
Of the
offense after medical cannabis became legal.
Correct.
But if it's been 2 years.
Yes,
since
then
that
one
year-
of those gets waived, right?
Yeah,
That
yes,
was-
right.
Yeah.
Should
But
consider
so-
not doing that for operators.
Those two, which I can help write out, with the exception of those two disqualifications, and to waive the fee. The application fee
For caregivers.
for caregivers and guardians.
And replace it with a self-attestation.
But yeah. I told you, we do it in post,
Yeah, that's-
don't worry.
Alright. Let's go to a roll call vote.
Kenny Anderson,
Yes.
Nana Barassi, yes. Candy Clark,
Yes.
Desiree Hempsey, yes. Jimmy Higgs,
Really quick, I don't know if you guys can hear me or not, but I had my hand raised. I just had a quick question. If someone's, so right now they disclose, but then they have to go through the background check process also. I'm just wondering if now if we're just leaving it up to them to disclose, if there's any penalty if they lie about their history. So that would be my only thing is if we could add that on there would be a penalty if someone falsifies that disclosure. Just as a deterrent.
You know, I think that's a good point, Jimmy. I think we can add that they'd be under, that attestation's done under the penalty of perjury. And that's usually what we require of any other legal document where we allow people to self-attest to things. It's done under the penalty of perjury, so, good point.
And with that, I'm good with it.
We need to read.
Yeah.
Make the motion again.
Make the motion again.
Just accept it as a friendly.
Yeah, I was
amendment.
gonna say, yeah.
Yeah, you can amend it.
It makes beautiful.
All right, we'll make this easy. I recommend that we make a recommendation to the legislature to do away with the background checks for guardians and caregivers and replace that with a self-attestation that they have not committed a disqualifying felony or cannabis distribution offense, that those terms are defined in the medical cannabis laws. And that that attestation be subject to the penalty of perjury. And that we further recommend that the legislature waive the application fees for caregivers and guardians.
Seconded.
All right, it's been seconded again. All right,
Kenny Anderson,
Yes.
Nana Barassi, yes. Candy Clark,
Yes.
Desiree Hempsey,
Yes.
Jimmy Higgs, Jimmy Rosen,
Yes.
Chris Morgan,
Looks like he dropped off a bit ago.
Matthew Gage,
yes.
and Nikki.
Yes.
Good motion.
I need to take a road making class.
Law school.
It's incredibly expensive.
All right, appreciate that. That did pass. 8 present, all voted yes, 1 absent. We'll go ahead and move on to the next item, which is job protections for medical cannabis patients, and turn the time over to Ms. Hennessy.
Did you guys read this or do you want me to just kind of, I can read it, I can just brief it, how many minutes do I get now?
I mean, I don't believe you're wanting to do a vote on it today.
No, well, no.
It's
I
for
think
presentation, so it won't be.
We're starting today, but I don't think we're gonna vote today.
I think, I mean, we won't open it up to public comment or anything. We'll just get the board up to date.
Yeah.
And then next meeting, we'll go in further detail.
So I'm gonna be fast then. You guys can read all of my long-windedness that is half of as long-winded as it was when I started. So, basically, when we started this cannabis program, in the meetings, we were like, okay, we're gonna say that this is legal. We're going to, say that public employees get to use cannabis. There's really no way of saying, we're gonna say this is legal, but we're gonna still say it's illegal if you have a state job. So, and then the conversation began, like, do we let we expect that private employers follow the same lead, that they allow their employees to use medical cannabis. For a couple different reasons that, we decided, like, they decided, I was just involved in talking with them, so they decided that no, they were not going to at that time. One reason Utah's a right to work state. They didn't want to get involved in private business. Another thing is we had a very limited time to talk about this, and we didn't want to step over things that we didn't know about. So, so that's where it landed, was now state employees have protections, private employees do. That's been one of the most difficult things for a lot of people, not allowing them to get their card. Most of the patients that I talk to do not have a safety sensitive job. It is just bias. And so you can see it says, as of September 2024, the public sector accounted for only 15.7% of all jobs in Utah. Approximately 84.3% of all of Utahns are employed in the private sector. So we have 84.3% of Utahns that possibly would be using cannabis if they could, if their employer would allow it. Not that we're trying to open the door for, for everyone to use cannabis, but if they're needing it and they're not finding relief, then this is probably a conversation that it's, in my opinion, is time to start having. So, one thing that we should mention is there's always the federal compliance, right? There's always, if you have a contract with a federal agency like Post, if you're going through Post, you are a state employee, you cannot use cannabis. I will work on that later, but that's what we're doing now. So because you have a gun, you have to go through the Post requirements. I forget what that code is, probably JD remembers, but because of that, they cannot use medical cannabis. So that would still, those situations would still be honored. If your job, I'm trying to think, I think there was one inside of the Department of Ag that you guys got federal funding. Talking to somebody in Ag when this very started, and they're like, well, we get federal funding or we have a federal contract. So if we tested positive, we could no longer have, like, the whole organization could no longer get that federal funding. There's a couple jobs like that, and that's, they mention it when you apply, and you would know when you were working there. If you're a pilot, this would not protect you. If you have a CDL license, this would not protect you. So all of those things are already protected for, and we are not asking in any way that we would start trying to get in between that. So you can see on the chart, like, the states that allow public and private, or they don't have protections. Utah is only one of two states, Utah and Louisiana, that only offer protections for public. They don't also say, hey, as a state, we voted that this was legal. We used our state rights to say that. We're also going to say that if you work in this state, we said it's legal. And that's really a lot of the argument for me is, in Utah, we voted to say that this was a legal medication, that it should be treated like a medication and observed like a medication. And yet we have 84% of our population that is possibly disallowed from using it because just strictly where they work. And so I would like to look at moving forward that I would be asking for a vote, or I'd be asking for some kind of movement on this. But then I talked to Kent the other day, and he had some good points maybe he wants to bring up to you guys about just other people that maybe we should involve in this conversation. That, and well, I look at this and I'm like, no, we've kind of hit all the boxes. We understand the situation a lot better than we did that. Now there's other agencies that I think we should bring into this discussion before maybe we have a vote. You want to talk about that?
Yeah, yes, thanks for taking the call. Obviously, you're talking about 85% of our employees with private employers. So to me, it's important to have private employer feedback on this, because I think that I agree with the statements that you're making. And I also believe that, and this is what the board's thought, the state's thought, is this is going to be medicine. We're going to treat it like medicine. I looked at the state law of how they looked at for their public employees. And so it's essentially, if you're not going to allow an employee to use an opioid, they wouldn't be able to allowed to use medical cannabis either. But that's being very specific with specific job descriptions. I think it's important, particularly on the federal component, you think about the Hill Air Force Base contractors, some of the largest employers of the state. We want to make sure that we're not jeopardizing their business. And we certainly want to make sure if a recommendation is made and it makes it up to the Hill, is that there's not a groundswell of opposition to this that kills it before it even gets very far into the conversation. So is what I'm asking is an opportunity for the business community to give us some feedback on what would be, is there, you call them carve outs, but if there's exceptions, if there's things that we need to think about. I was thinking about, and I started just doing some general research on insurances that people have to carry. You can't disallow someone from doing this, but you can provide a premium if you have a drug-free workplace. And so there would be an additional cost that then you're allowing cannabis potentially. Now, this is one that I found. I'm not an HR professional, a business professional here. This is just one thing that I don't know what that impact is. It may be negligent. But I think it's important before we make a recommendation. We've had the business community an opportunity to provide some feedback. I did share this agenda with as many of the business associations that I thought would be, as opposed to trying to talk to every single employer. I sent it out to some different business associations, mentioning both the May 20th meeting and then this meeting today. We may have an opportunity to get some feedback from but yeah, I appreciate you taking that time to take that feedback and make some modifications.
No, it was good, and I think if you guys are okay with that, maybe we bring this back to next month's agenda item, and Kent and I can work on just things we can get somebody from those areas to come and explain if they have any concerns that are real, right?
Well, I think you should come up with a statutory proposal, because if you look at these states that allow it, that provide protections for both public and private, they almost mirror each other, right? There's a little bit of difference in some of the language, but it's very similar. It's basically, you don't have to allow consumption on the job, you don't have to allow intoxication on the job, and you don't have to do anything to put yourself in a position to violate federal law or under the special funding, right? They're all some different flavor of the, of the same. The one thing I appreciate that you did say that you've reached out to them, because I think as board members, if you have, it may not be your topic, but if you think that there are certain parties who are interested parties or stakeholders, I think it's incumbent upon whoever that board member is that brings that concern up, that you go out and seek out those parties, right? Like, it's nice that you told Des, and I think it's wonderful that you then went that extra step to say, okay, I'll contact those people, because I think that's important too, right? Because I'll say is I sit here right now, the way these states have done this, I think it alleviates any concern that a business could have personally. So I wouldn't feel the need to necessarily involve those stakeholders, and plus they all have a very strong lobby and they'll all be up at the Capitol next year anyways.
Well, I talked to their lobbyists and they were okay.
Regardless of what we recommend, I can also tell you this will be a fighting point at the legislature, just especially the way the last session went. So I do appreciate the way it went. I don't think we necessarily need to do that, but I think it's not bad practice to do it, because I really think that you could make a recommendation from the language that's used in other states that would alleviate any concerns. They could still drug test. They could still find ways to, I don't want to use the term discriminate, but that's the word they use, against, people, working for them that use cannabis. You don't have to, allow it in safety sensitive positions. So I think the way the language already exists in other states, and you look at it too, you can go from a really conservative state like Arkansas, to less conservative states, and Pennsylvania was conservative this last election, a state that's not always thought to be traditionally conservative, right? And they all are kind of saying the same types of things. I just think it's just unfortunate that people are still losing their job, or could lose their job simply because they're in that organization that is off the block. I don't think anyone around here, I don't think anyone from the industry is going to say that we should create this just kind of, ironclad exception that, cannabis is going to be treated like, different from other controlled substances, right? I think the laws always strive to do that. So I think it is worth us maybe bringing those folks in. But I think
them an opportunity.
Yeah, exactly. Just letting them know, hey, you're invited, you can come. But again, I think if you look at the way these laws are laid out, I think they've all kind of thought through the process the same way. And I think that also helps insulate it a little bit from a lawsuit, right? Because where a lot of these things have been challenged, and really the reason why private employment has not been as successful as protecting public employment is because of that. I think it was a good Dish Network with the DirecTV case out of Colorado. And that's where they said employers could follow federal law, and that's essentially what they did here in Utah. But I think if you water it down a little bit and say, hey, employers, you don't have to do this, you don't have to do this. But if someone is a responsible medical cannabis using, employee of yours, they should not face termination simply because they chose to use the medicine that's more stigmatized than others.
Yeah, I agree. And then thanks for the comment too about the statutory, because I think sometimes is what can be helpful when you get feedback is here's the language we're proposing. And get some feedback from that. Yeah, as opposed to here's a giant bucket. Go ahead and dive on it.
Yeah, start pulling out of it. So what, how about this during the interim, I can look from between now and the next meeting. I can, you guys can send me any questions or if you have any questions right now, things that you would like me to clear up, and then I will show back up next month with some statutory language proposal.
Yeah.
And then they can show up and try to pull out of that smaller bucket.
Yeah.
I think the more refined you can be on your language, so we know what we're getting into.
Take that chart.
Then it's
I know.
then it's easier to work on. So,
I will remove
Okay.
the accent.
Nice chart prepared by.
any questions
Yeah.
from the board? Yeah, thank you for your presentation.
Do you want to see if there's one?
Yeah, we can. I know you did invite some people.
Yeah.
We'll see. Is there anyone online who would be representing the public or private companies that would like to make a comment? Please raise your hand.
We've set them up to wait.
I know, that's why I didn't necessarily think they'd be here. Well, if we don't get to you today, you'll definitely have opportunity next meeting on May 20th to push some public comments. So with that, we'll go ahead and move on to our last main item for the day, and I'll turn the time over to Mr. Lauritsen.
Thank you, Mr. Page. I'm sure everyone will hopefully have a chance to read the memo that I put together. Really, where some of this came from is it's not so much trying to do away with exit packaging requirements. It's not so much trying to do away with, concealing medical cannabis to protect PHI or whatever it is. It just seems like Utah goes a little further than most of the other states when it comes to exit packaging. So the way the law currently reads is anytime a medical cannabis patient is in public with their cannabis, they have to travel with it concealed inside the same opaque bag or box that they got at the pharmacy. Now, I know that's changing a little bit, right, with the requirement that now allows a patient to bring their own bag or box, but it just seems like overkill. Like, we don't do this, as you read in my memo, we don't do this with any other medications, under Utah law. We don't do this with any other medications, under federal law. And I just feel like it's just like, hey, don't ever let anyone see this medicine that you have, right? We already require that it has to be, unless you're using it inside the original packaging with all of the labels, affixed to it, from the processor to the pharmacy. Everyone knows what's in that container is medical cannabis. And I'm not saying that, the purpose of this is to allow it to be flaunted to minors or whoever. It just seems like an extra unnecessary step. So what my recommendation is that we just remove the requirement, in law that says that anytime a patient is traveling with cannabis in public, they have to conceal it in an opaque bag or box. I think in practice, that will probably happen for most, right? When you leave the pharmacy, you'll get an opaque bag or box. You'll take it home in that. If you decide to travel with it somewhere else, you probably put it in your luggage, in the rear of your car, right? It's not going to be out anyways. And if someone is traveling with it generally in public, they'll probably have it in a purse or another bag or a pocket or something. But I just hate to think that patients can face, as you guys see in here, potential criminal penalties for that, right? Like, even though it's an infraction and $100 fine for the first, 2 times you do it, the third or subsequent time, it becomes a misdemeanor. You just don't require, it just seems like, overkill. And in my review of the other states, it seems like most states do have some sort of requirement of what you take away from a pharmacy or dispensary. And I'm not saying we upset that, I just simply get rid of this other, potential pitfall. I don't know how big of an issue it's been or not for patients, but I think where this program has shown itself to be responsible, we have almost 100,000 users now in the program. I just feel like removing this burden, although it's a very small burden, just helps us to continue to normalize, cannabis. So with that, I'm happy to answer any other questions that people have. The memo basically speaks to all of that.
And I would like to point out that most of the patients that I talk to don't even know that they're supposed to have it in something when they're outside of the house. They literally have no idea. And so, luckily, I haven't run into a lot. I have run into some that have been ticketed, but I haven't run into a lot. Because once they show their card, usually the officer is kind and, you know, lets them go. But if at any time this was to be used, it could get very heavy-handed.
And you also do, I mean, I get that the whole concept was like that most people are gonna consume medical cannabis in their homes. But there are some people that do have qualifying conditions and symptoms that require them to travel with cannabis outside their home. And I would hate to just find a way to trip those people up who are just trying to treat, you know, symptoms. You know what I mean? Like, I can get it. I mean, I know we've had other laws in this state around, you know, making a cocktail behind a, you know, a wall and stuff like that. That was done away with, right? You know, not, it wasn't a good idea and it, you know, so I don't want to liken medical cannabis to alcohol because I don't really like to do that, but I think we've had other kind of nonsensical laws like that have gone, you know, by the wayside. I don't, and again, what this is limited to is not saying that the pharmacy doesn't have to provide an opaque bag or box to carry away. It doesn't say a patient can't bring their own. It doesn't say a patient can't do that on their own when they're in public. It just doesn't make it legally required and tie a potential civil and criminal penalty to it.
My understanding with the intent of that language was to they wanted to protect the patient so they could verify that the medication they were using was theirs. Because it does have their name, they have to have the name, and now most patients rip that off. But
Is it the receipt required to be with the product?
No, you don't have to have a receipt. That was, cops were trying to require that as well, that was the early days, but
no,
even if I walk away from the pharmacy now, right, and I'm in my car and I decide to take it out of an opaque bag or box, until I remove any of those labels, which I'm not supposed to as a patient,
yeah.
it identifies identifies my RMP, my patient number, I mean, all of the identifying information is on there, and then the packaging, you know, based upon, you know, the regulations that we have from UDAP, I would be hard pressed to think that anyone picks up a medical cannabis product in Utah and does not know that that thing contains cannabis, right? If anything, it shields, and as you see, I put some things in here, right? It helps to shield, you know, HIPAA information and stuff. But to me, once I've gotten home with it, the pharmacy's done its duty to protect PHI, right? The pharmacy's done its duty to, you know, conceal, you know, that the patient's done whatever duty the patient has to even conceal medication. I guess they've done that. Yeah, I guess someone could look at you and say, oh, you got medical cannabis that was targeted for a crime. I think we could probably say the same thing about a bottle full of opioids. I imagine some people would want to, you know, engage in some criminal conduct to get their hands on that. But otherwise, I think a lot of it is just the perception of not allowing people to see medical cannabis. Just in general, whether it's in the production, right? You know, you've got to have an 8-foot fence, you know, and it's not visible from the ground level. And as I look through the state laws on most of this stuff, just generally, shielding things from public view is just beyond common. And I feel like once a patient has taken it home, and if they decide to travel with it again, they should determine what level of discretion or not they want to take with that medication. I just don't think that the state should be saying to them, will be subject to a criminal penalty if you don't carry it in the exact same bag or box that the pharmacy gave you or that you took to the pharmacy. So if I have, you know, I have some sort of opaque bag and I decide to use that, but that's not the one I took to the pharmacy to take it away. I mean, you can understand how ridiculous.
Well, I think my question is maybe this is for Jimmy, for their Jimmy, is, I mean, a normal patient gets a controlled 2 substance or whatever, right? If it's a pill and it's not marked, they don't have it in the bottle, right? They have to prove that, hey, they have a prescription, right? And there's ways to look that up and verify. Right? They would call the pharmacy or call the doctor or whatever. It's the same, you know, I would assume
well,
it would be the same steps that we would take.
Without a warrant and use your driver's license to check the EBS, right?
Yes.
And so once you're a patient and they determine you're a valid patient, they're to let you go on about.
So them having it in your original bag now.
Yeah, and if we're now going to allow patients to bring their own opaque bag or boxes, it's not going to have pharmacy logos on it. And some pharmacies don't use any sort of identifying packaging too, right? They might use a white bag.
And in the beginning, there was a lot of worry about like, well, how will the officers know? Well, we've had years and the officers they know, or they can find out, right?
Well, that opaque bag or box to me
Is not
is
gonna.
not a good identifier
No.
for whether that's legal or not, because then what I'm just, I found out that Olson uses white bags, or, Dragonfly uses this type of resealable bag, then I use that. To me, it's that, and look, I understand what's gonna be the hardest, I think, for patients in general, is vape cartridges, right? You attach it to your battery, and very rarely you probably keep it in that same packaging. So that's where you run the risk, but if you're traveling with it, you wanna make sure you're compliant, keep that packaging with you with the labels attached, right? And if you have to, take the vape cartridge off your battery, put it in the package, it's annoying. But that's your likely, form factor that probably is gonna create the biggest issue. Most people are gonna keep their flour in the original container. Most people are gonna keep their gummies in the original bag and stuff. So I just don't think it would be an actual way to really identify that it was a legal source.
No, well, and that's why the processors were required to have child resistant packaging, that they can be reused, right?
Yeah.
Because the patient has to have the ability to put the vape back into the bag.
And to speak to kind of that child resistance too, that's some of the stuff as I was looking at it, where I was like, there was this one state that requires specifically things around exit packaging. And but even then, it wasn't necessarily talking about, it was talking about more like, the branding and the things that you put on the exit packaging. I can understand if Utah said, hey, Matt, use a processor, you don't have to do, tamper evident or child resistant packaging. And that bag, right, the exit packaging then becomes that. I can understand more of the reason for saying, hey, anytime you're in public, but for right now, it's already all done. This is just honestly, to me, it's the current law, just, annexation.
All right. Any other board questions?
I want to make a motion, but does Jimmy have any comments?
Jimmy, I know we haven't seen a hand or anything, he might be. Is he still there? Yeah, there's Jimmy.
So I apologize. I'm in Moab and I have really bad internet service. And so I'm not getting the whole conversation. But I guess, am I hearing that we don't want to have it to be in the original packaging so they can just have it in whatever packaging they want?
No, so they would still be required to have it in the packaging that the product comes in, right? Like, so the vape cartridge comes in a box, they would still have to have it in that as part of them being able to possess it legally. It would still have all the required labels and everything on it. What this would do is, currently when you go to a pharmacy, they have to give you an opaque bag or box to carry your products away in. Then as a patient, even if I've gone home and it's 60 days later, my product's not expired, I can still have it outside my house legally. I would have to have it in that same opaque bag or box, the exit package, to have it, to be able to possess it legally in public. If not, it's an infraction, and then 3 violations or more of that, it becomes a misdemeanor. So this would just be for exit packaging once a patient decides to travel in public with it. It's that, not the actual packaging for the product. Not to say that we as pharmacies can start selling vape carts with no packaging and label, right?
I guess that would be my thing. Just like I said, just getting bits and pieces of the conversation. The concern would be, how do we identify where it came from? Because then you start getting into black market issues. Did it come out of Wendover? And so as long as, to me, the packaging would have to clearly show that it was legally purchased in Utah from a Utah pharmacy.
And it does require that. Whether it be the processor label and then really the pharmacy label will show you the pharmacy it was purchased from. So just like any medication, that labeling will tell you on the package itself. The exit packaging, other than maybe being branded, has nothing on it that would ever prove one way or another whether it's legal or illegal.
Thank you, Jimmy.
Take some feedback.
Well, we'll open it up online, and there's no public comments for in the room, so. Do we have anyone online who wants to comment? If not, we'll move right back to the board. Doesn't look like we're online. I know I can trust you, JD. Are you gonna make the motion?
Yeah. Yeah.
Yeah, so,
Well,
it sounds like Kent
yeah.
has a motion.
Yeah, well, there was an excellent memo that included some recommendations for motions, which really helps. I appreciate that. So I move to recommend that the legislature remove the requirement that a medical cannabis card holder, when transporting medical cannabis in public, do so within the opaque bag or box provided by the pharmacy, or the opaque bag or box that the card holder provides.
Almost like I wrote it myself.
Guys, we do have a second. Go ahead and do a roll call vote.
Kate Anderson,
Yes.
Nana Rosie, yes, Karen Clark,
Yes.
Desiree Hennessy, yes, Jimmy Higgs, JD Lorenzen,
Yes.
Matthew Page,
Yes.
And Misty Smith.
Yes.
Now, did we get Chris back at all? Okay. All right, with that, we do have a unanimous with those that are present. Of 8 and 1 that's absent. We did make up some time. I want to thank JD. So next meeting, we will have the requirements for the, or not that one. We'll have the job protections for medical cannabis on the agenda. That will be one of the items. We do have that list of stuff that we've worked through. We do have a couple more items that we'll be meeting to discuss. Just as a board, if you have anything that you'd like to see, now is the time to kind of get it in there so we can get a long list of recommendations in front of the working governance group, starting in August.
Yeah, I think the one thing I would say is, from the list we kind of created the last time, it seems like our two like bigger issues, other than this employee protections, is obviously decriminalization and home grow.
Yeah.
What you guys may think about during your planning session this week is who in terms of board members might be good to kind of team up on those issues, because again, both of those issues are going to be, hotly debated issues.
I mean, is there anyone that would like to take a shot at that?
I'm happy to take on decriminalization because it's something that's already interested in. But if anyone else is interested, I think when you guys meet, just think who you might think would be good.
Yeah, we'll have Trevor reach out to you.
Yeah,
Sure.
To see, and if you're not interested at all, please let us know.
Well, and I think
Trevor.
we at one point suggested that each of us come with something from each of our perspectives or
Yeah.
areas, especially that how decriminalization would impact
Right.
medical
That's
research,
Schedule 3,
pharmacy.
yeah, because decriminalization, when we're talking about that, I'm not talking about the move to Schedule 3 federally. I'm talking
Okay.
about them decriminalizing possession
In Utah.
in Utah.
Okay,
So
sorry.
similar, but I think you
Yes.
could still bring, I still think that in general, that idea of us all bringing something from our own perspective,
Mhm.
whether it's professional or personal, I think is important on those things, because
Yeah.
I think people are gonna have differing opinions on decriminalization and to what extent we engage in it, and home grow is home grow. Just leave it at that for now.
So,
Would you like to know the list on the tracker?
Yep.
What you have
Yeah.
just on here right now? So you have, as JD mentioned, home grow, state decriminalization. Then there's also product availability and consistency, combustion, changing the default medical cannabis patient card length to 2 years, self-certification for patients 65 and up, public education in general, law enforcement training and education, safety education for those 65 and over, and then cannabis possibly moving to Schedule 3 on the federal level.
okay,
That one you could put a pin in
for a while.
For quite a while.
Unless there's a curveball somewhere.
Still on appeal, so until the courts play it out.
I
Yeah,
think at one point we also wanted to look at other formulations.
Oh, yes.
Revisit that again
Oh,
and,
love to.
Those other types.
yeah,
Yeah.
Types.
yeah.
We just gotta be
Right.
careful.
Okay.
Last time we did it, we got more restrictive.
you got a suppository.
We got a suppository.
But I,
We'll use the word chocolate and ended up on the no-no list.
Yeah,
Yeah, the chocolates were, I don't know that we're ever going to get chocolate,
no,
but,
Don't mention anything else right now.
yeah, I'm gonna shut my mouth.
Yeah.
Keep it under wraps.
but if there are other form factors that are worth considering,
And
I think we should revisit.
The Center for Medical Cannabis.
I agree.
Hopefully come in to help us.
yes.
Because I remember having to ask you, right, so you were debating chocolates.
Absolutely.
Missy, does this have, is there any sort of, scientific backing for why chocolates would be a good form factor? Because I think that's where, they may not go with us, the lawmakers.
I think
but I feel
patient
like that's a
input,
much more defensive position.
patient input of what are they wanting, what are they needing, what are they asking for is also.
Is that part of the survey you all are doing of what other form factors they'd like to see that are not available in the Utah market?
I think you're asking that, right? In the survey? You forgot,
I thought-
you gave it with the survey now, haven't you?
Cody gave that look like the survey's not mine.
Not
Where are we on that survey? Is it going along?
Yeah.
Okay,
That's fine.
okay. Signed, everything's good, everything started? Okay.
If not, maybe we can talk about, designs on the survey. Because, I mean, look, I get it, that we're probably not gonna ever, allow pre-rolls here in Utah, at least that's a ways off. But it would be nice to know and informative to know what patients are potentially seeking out in other markets and not in the Utah market. Because at some point, I think, this idea of, trying to prevent patients from going across state lines or
Yeah.
forcing them to should be a part of the conversation, not just always the medical, efficacy. At least that shouldn't be the only thing that we're speaking about.
And that can help inform the research.
Yeah,
you know,
absolutely.
So it's not, no, we're not casting such a wide net. Yeah.
Patients are demanding a certain thing, you can prioritize.
Because you can find literature on things like intranasal delivery, but is that something patients would be interested in?
I tried for that.
Des
So-
love.
I'm gonna try for.
I'm like, yeah, you give me the one, yeah. I don't wanna do it. I got suppositories. I don't ever have to say suppository in a committee hearing again. And that's a win for all of Utah.
Absolutely, absolutely. And for certain patient populations,
Yeah.
you need alternative methods to get it in when
But
traditional ones don't
we did
work.
do
So what
like
makes it-
atomized. I mean, you could do like a inhaler,
Yeah.
and that's, we just.
Yeah.
It's all,
And you
So-
could have a confection,
Yes, that's very broad.
just not a chocolate flavor, so.
All right. Well, we do have a lot of lists. We'll get that and we'll get that sent out this week for topics for next month, for any help we need. With that, I'll look for another motion.
Move to adjourn.
All right, it's accepted and approved. Thank you very much, everyone.
Greg says big drink.